That's weird.
Okay. We ready to go? Is everyone in? Okay. Good evening, everyone. Thank you for joining us. As chair of this meeting, I need to confirm that all members and persons anticipated on the agenda are present and can hear me. School committee members, when I call your name, please respond in the affirmative. Elizabeth Albota.
Here.
Mary Branley.
Here. Oh, she
Hillary
made
Griffith.
Italian.
Here.
Natasha Rivera.
Here.
Okay. Staff, when I call your name, please respond in the affirmative. Colleen Andrade.
Here.
Jeff Ferranti. I see you. We need to hear you.
The host was not allowing me for a moment there. Yes, I'm here.
Okay. Jennifer Gadat.
Here.
Okay. Charles Gabron. Do we see him or no? I'm going to assume no. Brian Haas.
Yes.
Adam Steiner.
Yes. Yes.
Wayne White.
Yes.
All right, thank you. Anticipated guest speakers on the agenda tonight. When I call your name, please respond in the affirmative. Kathleen Fitzgerald. I'm gonna look in participants.
Do we know what she's called in here?
Oh, Charles is here, by the way.
Oh, hi, Charles. Kathleen might not be here yet. All right. Dr. Carolyn Imparato. She's muted.
I'm here.
Welcome. Karen Lindquist.
I'm here.
Welcome. And Jen Piccarelli. Who, I see her. She's here.
She just entered the meeting, so I'm not sure if her side's
Okay.
on up.
Jen Piccarelli, raise your hand so we can unmute you.
Jen, you should be able to unmute.
I'm unmuted. I'm here.
Oh, there it is.
Okay, great. Thank you. This open meeting of the Maynard School Committee is being conducted remotely as allowed by the act Governor Baker signed into law on June 16th, 2021. An act extending certain COVID-19 measures adopted during the state of emergency includes an extension until April 1st, 2022 of the remote meeting provisions of his March 12th, 2020 executive order suspending certain provisions of the open meeting law. The new law has two major parts. First, the new law allows public bodies to continue providing live, adequate alternative means of public access to the deliberations of the public body, instead of holding meetings in a public place that is open and physically accessible to the public. Second, the new law authorizes all members of the public body to continue participating in meetings remotely. The open meeting law's requirement that a quorum of the body and the chair be physically present at the meeting location remains suspended. All other provisions of the open meeting law and regulations, such as the requirements regarding posting notice of meetings and creating and maintaining accurate meeting minutes, remain in effect. Public bodies are reminded that notice of all meetings must be posted at least 48 hours in advance, not including weekends and holidays, and the meeting notice must clearly specify how the public may access the meeting, whether in person, remote, or both. This committee is convening by Zoom video conference as posted on the district's website. Please note that this meeting is being recorded and that some attendees are participating via video conference. Accordingly, be aware that other folks may be able to see you, and take care not to screen share your computer. Anything that you broadcast may be captured by the recording, which is audible to and viewable by the public. Additionally, please let the chair know if you are recording or broadcasting this meeting prior to doing so. Use the raise your hand function now if you are planning to record or broadcast this meeting so I can make note of it. I do not see any hands raised, so I will assume nobody is recording or broadcasting. Most of the supporting materials that have been provided for the members of this body are available on the Maynard Public Schools website in a folder titled 2021-2022 Agendas under the tab Agendas under the tab School Committee. The public is encouraged to follow along using the posted agenda and documents unless the chair notes otherwise. Citizens' comments. Any citizen wishing to make a comment to be read, and Colleen, can you put in the chat the address? Thank you. Any citizen wishing to make a comment to be read during a virtual meeting and entered into the public record may do so by emailing comments to comments4scmeeting@maynard.k12.ma.us. And that's comments for the number 4 SC meeting, all one word, no spaces, no caps. Comments need to be emailed in advance and will be received up until the citizens' comments agenda item is addressed. Please include public comment in the subject line and your full name and street address in the body of your email. Emails without this information cannot be read. To ensure that your statement is read in its entirety, a 350-word limit is suggested. Statements longer than 350 words may be cut short at the 3-minute mark in the interest of time, but will be submitted in its entirety for the public record. Comments are limited to 3 minutes or 350 words to ensure that everyone has the opportunity to be heard. The chair will read only one statement from each citizen. However, citizens can submit any additional comments for the public record by providing a copy to the chair via email up until the end of the meeting, specifically stating the desire to have these additional comments included in the public record. Please be aware that the purpose of the citizens' comments period is a devoted time for the school committee to hear from the community it serves. As such, the protocol supports the unidirectional public sharing of citizens' comments rather than a bi-directional conversation. Ground rules. Before we go to the first item on the agenda, permit me to cover some ground rules for the effective and clear conduct of our business and to ensure accurate meeting minutes. I, the chair, will introduce each speaker on the agenda. After the speaker concludes their remarks, I will ask each member in turn if they have a single comment, question, or motion that they would like to make. I will go through the members for additional comments or questions as time allows. Please hold off speaking until your name is called, and remember to speak clearly and in a way that helps generate accurate minutes. Please do not interrupt anyone who is speaking, and cease speaking if the chair requests you to do so. Finally, each vote taken at this meeting will be conducted by a roll call vote. So we are now going to have a roll call to open the meeting. Elizabeth Albota,
Yes.
Mary Branley,
Yes.
Hillary Griffiths,
Yes.
Natasha Rivera,
Yes.
Lydia Clancy, yes. Okay, first order of business is to approve minutes. I think at least Mary and I both had some edits. I don't know if anyone else had any edits. And do you want to go through them now, Colleen? Okay. So on the first page, under discussion around having more inclusive discussions, it says in 1, 2, 3, 4, 5, in the 5th sentence, it says as well as felling. I think that's supposed to be feeling. And then Mary gave you the comment about for rooftop solar panels once the new green row was built, because the high school will have aged, high school roof will have aged out by then.
Yes.
Okay. And then we cleared up the passage where Natasha had technical difficulties. It was suggested rescinding the motion. Mary rescinded. we voted on the tabling of it until Natasha could get back on.
Yes.
And that is all I had. Oh, no, I didn't. In the, okay, sorry, on page, what is that, 1, 2, 3, 4, page 4 at the top. It was asked why it mentioned reporting. Can we just say it was asked why the description mentioned reporting to the principal?
Mention.
Because I'm not sure what it is referring back to.
The job description, I think, mentioned reporting.
Yeah,
Yes, the job description.
yeah. So I just wanted, instead of saying it was asked why it, if we
The
could just,
job
say
description.
it was asked why, yeah, the job description mentioned reporting, yeah. And then the next paragraph, Ms. Branley made a motion at the end of that sentence, and term. Do you mean the title, curriculum and instruction? Is that the,
No, it actually, I definitely clarify that. The term of the position, meaning the 1 year.
okay,
The
yes.
term,
okay, thank you.
meaning it was a 1 year position.
Yep. And then my last one, under MTSS positions,
Mhm.
Ms. Clancy asked that a way to evaluate and assess the progress of the positions be determined. How? I think determine whether they help students and in what areas. Does anyone else have any other edits?
I do.
Okay. Natasha?
Yeah. Colleen, you ready? I think I put them in the
Yep.
margin,
I'll
but
follow along.
yeah. So one of them actually was just a comment, and we could, for the future discussion, but I saw about the literacy committee. We were supposed to get that an update there. So I just wanted to highlight that if we could find out, maybe that would be homework assignment for Brian as far as when we would get that, because that wasn't at the next meeting. And I know we've had our plates full, so it'd just be good to hear that. But the minute description under page, under the summer school program,
Mhm.
I had added in suggestion, the second paragraph, where it said suggested to get the word out soon. And then to end that there, and to put members express concern that possibly too late in offering since parents had already made summer plans, reassurances made by Ms. Vedette of community interest.
And that's it, right? Nobody else?
That is all I had.
All right.
Okay, so without objection, I would like to accept the meeting minutes from 5/20/21 as edited. No objections? Okay, they are accepted. Second, I would like to, without objection, I would like to accept warrants 22-001, -002, and -003.
So I would like to abstain from any action on warrant 002. So maybe without objection, you can accept the others and then do a roll call vote for the other, for 002.
Yep. Without objection, I would like to accept warrants 22-001 and -003. No objections, so accepted. And then we're going to vote to accept 22-002. And Natasha, I believe you're abstaining because there could be a potential conflict of interest. Is that?
I'm just abstaining.
Yep, okay. Okay, so roll call vote, Elizabeth Albota,
Yes.
Mary Branley,
Yes.
Natasha Rivera,
Abstain.
okay, Hillary Griffiths. Where is she? Oh, there you are. She's muted.
Yes.
Okay,
Can we,
All right.
can I just for future reference, and I think Colleen was going to do this, but I know you've been slammed. Could we just put in what the warrants are ahead of time that we're going to be voting on? I mean, we all look at them, but just so that we can look at them again before we actually vote.
I do have them in the Lydia's version. that
Yeah,
has,
they're in the
you know,
chairs. She adds them to
Oh,
the chairs
okay.
thing because usually she posts the agenda to the town or gives it to the town before. we
Sorry, I didn't look at that one. Sorry about that. Okay, never mind. That's great. Thank you.
All righty. So next we have urgent business. Brian, do we have any urgent business?
We have a lot of urgent business.
Stop it.
Defines it as urgent business tonight. We have a lot of important business tonight, but no urgent.
Yeah, okay, great. So now we are on to the citizens' comments period of the evening. I am going to pull those up.
the latest one that was emailed is in the document.
Great, thank you so much, Colleen. All righty. So, first we have Julie Quattromini, Boski Ave. On the topic of masks, please take into consideration of children with special needs, especially those with language barriers. These children comprehend information and learn to do the same gestures by physically watching someone's lip and mouth movement. With a mask on, learning is extremely difficult to communicate with their peers and teachers. This is huge for their own growth and social emotional interactions on an everyday basis. We have tried the masks with the clear piece on them. They fog up, even with all the tricks on how to not get them to fog up. With a child with communication disabilities, where they require seeing the mouth of those who work with them, how are you going to ensure their educational experience is successful this year if masks are mandatory? A few other points I want to bring up. Summer school this year in Maynard and across Massachusetts, masks were optional. Not once did we get an email or anything there was a kid or a staff member who had COVID or had to quarantine. I also want to bring up the everyday things like sports. Throughout the summer, masks were not mandated, both inside or outside. My son played on one of those teams that was held inside a facility, and through the 12 teams, not one child got COVID for the 8 weeks they played a contact sport. Please also allow teachers to give you feedback as well. I can't imagine the struggle teaching kids with a mask on, especially the younger ones. Wearing or not wearing a mask should be a personal choice for every individual parent or staff to make. What might be best for your child may not be the best fit for mine, as everyone individual needs are different. Please take these suggestions into consideration when you make your decision for all students and our staff in Maynard. Thank you. Jess and Nick Crefting, Roosevelt Street. We are Jess, healthcare worker, and Nick Crefting, physics teacher, parents of a Green Meadow student. We are writing to voice our support for implementing universal masking at all Maynard schools. All available evidence indicates that SARS-CoV-2 will spread in schools without mitigation efforts, including universal masking. The CDC and the American Academy of Pediatrics agree. Both agencies have released guidance that schools should mandate masks for students, staff, and visitors. As of 8/5, the CDC recommends universal indoor masking for all students, staff, teachers, and visitors to K-12 schools, regardless of vaccination status. We implore you to listen. Though infections in Massachusetts declined earlier this year as vaccination rates increased, the Delta variant poses a serious threat. Delta is much more transmissible than previous variants, and data from Middlesex County reflects that reality. Cases here increased roughly tenfold over the past 6 weeks alone. The science on kids and COVID is clear. Children can be infected with the SARS-CoV-2, can get sick and die of COVID-19, and can spread the virus. While kids are less likely than adults to experience severe illness or death, the long-term consequences of COVID infection on neurological, lung, metabolic, and cardiovascular function remain unknown. Recent studies estimate that anywhere from 10 to 45% of kids under the age of 12 who are infected experience long-haul symptoms lasting more than 5 weeks after diagnosis. Over the past 18 months, we have learned how to reduce transmission and infections. Masks are crucial, scientifically proven mitigation strategy. Evidence from the CDC shows that the relatively low levels of infections in kids during the 2022 school year were in large part the result of school closures and widespread mitigation efforts in schools, including mask mandates. Wearing masks is a small sacrifice which will help ensure that our kids can remain safe while going to school, which we know is important for their intellectual, social, and emotional development. We want to remind you that it isn't alarmist to do as much as we can to protect our town and our children. Masks should be required, especially for our most vulnerable unvaccinated students. Thanks. Next, we have Molly Bergman, Wood Lane. To the school committee, thank you for your service on this committee and commitment to Maynard's children. My comment is to encourage you to vote to make masks and distancing optional for the 2021-22 school year for the following reasons. Children are at extremely low risk from death, hospitalization, or other adverse events due to COVID-19. They face a 3 to 4 times higher mortality risk from flu versus COVID and a 10-time risk of suicide. Even with Delta, children are at extremely low risk, with some data suggesting that pediatric hospitalization rates for Delta are less than half what they were for earlier variants. Children are not super spreaders. They are not the reservoir of COVID-19 that is prolonging the pandemic. Multiple contact tracing studies have shown that the RO for children is actually below 1, meaning it is mathematically impossible for them to drive this epidemic. They are epidemiological dead ends. Mask mandates, especially in schools, do not reduce school or community transmission. Masks are ineffective and actually harmful. The data supporting these conclusions is included in a separate letter sent to Superintendent Haas. Thank you for listening to my comment. I realize that this is a very thoughtful time and I appreciating how challenging your position is. I hope that hearing as many perspectives as possible will help you in your decision-making process. Sincerely, Molly. Next, we have Sarah Bernardi, who is a GM nurse. Dear school committee members, I hope you're doing well. I wanted to make a comment about a few things as I was not involved in the process of deciding about the CIC program. Who is the district coordinator for this program to direct further questions? Will there be a separate email and phone number dedicated to questions and answers about results, testing, etc., as this is suggested by DESE? Under the testing section in the agenda, it states that RT-PCR testing will be done, but according to the CIC, the only testing MPS would be doing with the symptomatic and test and stay options would be the Binax antigen testing. Can this be clarified? After listening to the recorded webinar by DESE about CIC, it states that districts have the option to hire CIC staff. Please see the information from the recording at the end of this email. Has MPS signed up for this option, hiring CIC staff? Where will this testing be taking place? There are no longer separate caring rooms set up at the Fowler or the high school. Green Meadow is the only school with a caring room still set up, but it does not have a window on the door. So the nurse will be unable to leave the student alone while waiting for the testing results, etc. Most all places, doctor's offices, CVS Minute Clinic, etc., do not allow symptomatic patients to wait inside a building while being tested and awaiting results. Specifically related to young Green Meadow students, it is not advisable, in my humble opinion, to use the nurse's office as a place where COVID testing will be taking place. Any portion of the nurse's office should be considered a safe place that doesn't involve COVID testing. What is the plan to support MPS students who need immediate assistance by the nurse, need timely medications given, etc., when the MPS nursing staff are being held up in a separate area testing students' staff? Binax tests need to sit for at least 16 minutes and no more than 30 minutes. This is assuming MPS nurses are doing the testing. This process involves putting on and removing full PPE, gown, gloves, face shield, N95 mask. And this email continues to go on, but it is way longer than 350 words. So I'm not going to read all of it at this time. It will be included as part of the official record of the meeting minutes. Hello, this is a lock guard residing at Walcott Ave. We have 2 children going to elementary school this year. We strongly believe universal masking, regardless of the vaccination status, and social distancing programs are the cheapest and safest way for all kids to still attend school in person throughout the year. Regards. Dear school committee members and Superintendent Haas, I'm strongly in support of a mask mandate for K through 12 and teachers and staff. Both of my children are in Fowler, which has a population of both vaccine eligible and ineligible students. This is my household. I strongly feel that we need to continue to require masks given the rising number of COVID cases in Mass and throughout the US. I work in higher education and we are requiring vaccines and masks for our entire community. If we don't continue to require masks, we will be back to some variation of last year when we were in a hybrid situation, or we will end up with whole classes in quarantine, resulting in continuous interrupted learning. Thank you, Erica. And that was Erica McDonald of Summer Street, Colleen. We fully support the COVID mitigation measures being proposed by the MPS administration in alignment with the CDC's guidance to include wearing of well-fitting masks by all students, teachers, and staff when indoors, regardless of vaccination status, as the best means of ensuring everyone's safety and uninterrupted learning. Ken Estabrook and Lindy Gear of McKinley Street. My name is Tiana Chase. I am the parent of, and I'm not going to say the student's name, Acton Street. I am beyond appalled that we are even entertaining these anti-science debates. Masks are in no way child abuse. What is willingly and knowingly exposing children to a deadly virus and ignoring preventative measures. The mask is doing them no harm. Since the pandemic began, children represented 14.4% of total cumulative, I think she means cumulative cases. For the week ending August 12th, children were 18% of reported weekly COVID cases. This data is from the American Academy of Pediatrics. As of August 12th, over 4.441 million children have tested positive for COVID-19 since the onset of the pandemic. Over 121,000 cases were added the past week, a continuing substantial increase. After declining in early summer, child cases have steadily increased since the beginning of July. 121,427 child COVID-19 cases were reported from August 5th to August 12th. 4,292,120 to 4,413,547. And children, oh, sorry, I'm messing this up. And children represented 18% of that, the weekly reported cases. Over 2 weeks, July 29th, 21 to August 12th, 21, there was a 5% increase in the cumulative number of child COVID-19 cases, 215,251 cases added. Refusing a mask mandate is foolish. This is coming from someone who's extremely against school dress codes, as I feel they offer little to no protection or benefits to children. Masks, however, save lives and take the pressure off our healthcare workers. I have been making masks and working with hospitals since the start of the pandemic. And no, not sewing fabric masks to hand out, but working with infectious disease teams and testing the efficacy of these masks and masks of any given material and their effects on the spread of SARS-CoV-19. This ignorance and doubling down on anti-science conspiracy theories is killing our citizens and needs to be stopped. Schools are a place of education, not make-believe. Clayton Scoble, Brook Street. Regarding masks, a brief comment to acknowledge that some children with special needs may well need special accommodations when their learning modalities depend on visual facial cues, and I very much support those efforts. Separately, my hope is that we all resist any temptation to factor in anecdotal evidence to take a pro or anti-mask stance. My strong personal preference is for there to be a mandate, but this is not through my own research. It is through awareness of the science and recommendations of institutions in a position to make these recommendations. Thank you. And that is all I have right now. I'm going to double check my email to make sure none came in while I was yammering. Nope. Got them all. Okay, thank you very much, everyone, for sending in comments. I appreciate it. I know the rest of the school committee does as well. And we have been doing a lot of reading, a lot of considering, and you can be sure that we have taken everyone's point of views and perspectives and concerns into consideration. So with that, I am now going to turn it over to Superintendent Haas for his superintendent's report.
Thank you, Madam Chair. Great to be here tonight with everybody. It's nice to see we have a large turnout. It's probably one of, if not the only advantage of a Zoom meeting, is that we have a lot of people in attendance. I have several topics to cover. I'm going to start with a really positive one because we spent some time this summer recently as an admin team doing some professional development and getting to know one another. So I want to introduce two of our newest administrators. First, Dr. Carolyn Imperato, who's joined us from the Acton Boxborough school system as the assistant principal of the Fowler School. She's on the screen there with those fancy, colorful dots behind her. She last year was the remote K-6 elementary school principal for the Acton Boxborough School District. Prior to that, she has a long career in Acton Boxborough, and she, along with that, she has a thorough knowledge of social emotional learning, conflict resolution strategies, and operational aspects of running a school. So we're thrilled to have her on board with us, joining the middle school, the Fowler School staff, faculty, administration, and being part of our family at Maynard Public Schools. Now, if she wants to say hi, say hi.
Hi, thank you for that great warm introduction. I was actually assistant principal last year. I don't want to take too much credit for being principal, but close enough. But I'm very happy to be here and be part of the Maynard community and the Maynard family, and look forward to doing some great work. So thank you.
Thank you. And then second, and on my screen, it happens to be right next to her. I don't know if it is on yours, but I'm excited to announce that Ms. Karen Lindquist has joined the Green Meadow team as the assistant principal for there. She has a long career as an elementary school teacher with the Wellesley Public Schools, where she has effectively instructed students in kindergarten through grade 2 over the past many years. She brings a wealth of knowledge and energy and positivity, including experience with project-based learning, standards-based report cards, school safety initiatives, and inclusive educational practices, all of which are very timely and important to us in Maynard. Specifically, one of the things that she was actively involved in Wellesley was the diversity, equity, and inclusion team and she was one of the team members who helped develop specific recommendations to address opportunity gaps. So we are excited to have her with us. You can see on your screen, if it looks like my screen, she's smiling and she's happy. So if you want to say something, there she goes.
Well, thank you for that. Thank you all. It's been such a pleasure to get to know the staff at the Maynard Public Schools, and I've thoroughly enjoyed getting to see students at the Tiger Back to School program this week. It was wonderful to have them in the building, and I'm really looking forward to being part of the Green Meadow family and the larger Maynard Public Schools community. So thank you.
Excellent, thank you. I'll now move on to what everybody's probably been waiting for, since we, as the chair has mentioned or referenced, we have spent, as an administrative team, I myself, and the school committee as well, hours and hours and hours wrestling with COVID and what does that look like? And it's a little overwhelming on given days, quite frankly. When we ended last year, I think people were pretty excited. I put myself in the group of, we were pretty excited. It felt like we sort of hit a mark and we were moving forward and we were looking at summer. And as June was rounding out, it was a great summer. We have summer schools planned. People are not wearing masks. People are starting to take vacations. It felt great. Got a little more interesting as July went along, I will say. In July, things started to percolate around the country with COVID, and there were concerns brought up, not just to us here in Maynard, but across the country about variants and whatnot, and people still getting sick, and people who are vaccinated getting sick, and the debate of who should get vaccinated and who shouldn't sort of roared on, took on a new life of its own, but it really wasn't sure in the middle of July what that would mean for us opening up. By the end of July, it was very clear that we were going to have to make some hard decisions, and superintendents were meeting and talking with elected officials, the Department of Elementary and Secondary Education, who once again chose to say, you should really look at the data from a variety of sources, from the CDC, from DPH, from your own boards of health, and you as educators, albeit not doctors, should make these decisions and recommendations, if you will, to your local school committees, who are then in the position, again, most of whom aren't doctors, some are on different school committees, but in a position to make decisions that are really medically based. It's a very challenging position to be in. And we all know that. We have families, and in this, right now, we're looking at the district. What are we gonna do for almost 1,400 kids, several hundred staff, and how do we keep everybody safe? So the goal, as August rolled around, we knew what our goal was. And our goal was to open schools, have kids and staff safe, and have them in the building full time. That's what the goal is. How do we do that? And as time has gone on, we've done listening sessions, we've done reading, we've done discussing, we've met with medical professionals, etc. So I will recommend to the school committee tonight that we do universal mask wearing to start the school year. So there's actually an item lower in the agenda, which is the actual policy per se that will take a vote. But I will recommend, as of August 23rd, 2021, that all students, staff, and visitors, regardless of vaccination status, must wear masks indoors while in any Maynard Public Schools facility. Face masks are not required when outside, or if you're in an individual workspace alone or in a segregated space. I think in weighing all the information, I think that is the prudent approach. And if you think back a year ago, this reminds me very much of how we articulated how we wanted to start last school year. We took a cautious approach and a prudent approach, and quite frankly, it worked. We didn't have outbreaks in school, but we followed the recommendations. We wore masks, and I felt good about that. I felt lucky working with this community. I felt lucky that our staff followed. One of our big concerns last year was, we spent a lot of time with the administrators online will remember, we spent a lot of time talking about, what about people who aren't going to comply? And what are we going to, and thankfully, the students and staff, that was a non-issue. People were happy to get back into school. They wore their masks. We took mask breaks. We figured that out. So going into this year, we've already done a lot of the hard work. We figured out how do we do mask breaks. We figured out how do we do what we need to do. How do we wash our hands for more than 2 seconds? How do we wash them for 20 seconds? How do we use hand sanitizers? How do we keep our masks on? How do we take them down when we need to eat? How are we respectful of people's space? We did that. We figured that out. It was a big lift. The teachers, the staff, everybody did it. We're going to have to do the same thing again for a little while. It will change. It will get better. I don't know when. The metrics out there right now, and we've had these conversations. We had another call with our nurse representative for the town and the schools. We don't have that exact metric yet. We will continuously reassess the situation and look at the information and work with the professionals. And when it's time, we'll revisit that, and it is changeable. So I want to be clear. I'm not saying we're going to do this forever or even all year, but right now, this is, it feels like the safest way to start the school year.
Okay. Thank you.
Understood. So, yeah, you're welcome, Madam Chair. In addition, I'll send a letter out tomorrow. It'll have the entire back to school questions and answers for you. I can go through some of them now. I don't know if that's, yeah.
Yeah, I'll go through, I figure before you do the rest of your superintendent report, we should probably do that now, if that's all right with you.
Absolutely.
Okay, I'm gonna go through Elizabeth Albota.
I'm sorry, my dog distracted me. What are we doing?
Did you have any comments or questions? I want to go around once and have everyone do one, and then we can go and do a second round. But did you have a comment or question about what?
Yeah, I mean, I guess one of the biggest questions I have that I would like to address is, first of all, I hear what you're saying about the mask mandate for everybody, but I have a lot of questions about lunch then, because lunch is a place where there are a lot of kids in one room and there are no masks on. And where my daughter goes to school at Fowler, there's just a tiny piece of plexiglass that goes up to about here between this kid and the kid across from her, but there's 0 things between her and these kids on this side of her. So if we're taking the science seriously and we're saying that it's important that we take this precaution and we're being cautious, then and we're following what reality is, then reality also carries over to the actual lunchroom too, and we have to keep that in mind. And so I'm worried about that. And I guess alongside that, the mask breaks and where those are taking place, because also those have to be reality based and those have to be outside if we're saying that we're following science.
Okay. Brian, do you want to respond before I go to the next person, or what? How do you want to?
I can respond individually, and some of these will be follow-up conversations. For example, lunch, you're absolutely right, is a challenge for every school across the state right now. There's no doubt about that, but the recommendations don't require the same physical distancing that they did in the past. And they do require and want all kids in the building. So there will be more kids in the building this year than last year. We did leave the plastic up as you described, the plexiglass, to keep hopefully the germs going across the table. We think that is helpful. And we'll continue to look at that. So I want you to know, I hear you loud and clear, and we are continuously talking about lunch as part of the conversation today. As a matter of fact. In terms of mask breaks, we did mask breaks last year when we had kids in the building. At each of the buildings, they figured out, and it looks a little different whether the kids are, in high school or in college school or in elementary school, but they did figure out how to do that. And weather permitting, they are outside. We're in New England, so there are times that we don't take kids outside in the middle of the day because we don't want them to get soaked. Often, Fowler, we're kind of lucky. There's that area in the front of the building with a roof, so you can get groups out there. So I hear you, and we are working on all those things. Some of them I think we have worked through, given our experience last year, but there's always room for improvement on those.
So Lydia, I can't ask the follow-up questions now. I can ask them later.
Yeah, I'm going to go around a second time. I just wanted to make sure everyone gets one in, and someone else may ask what. Okay, so Mary Branley.
So Brian, and I think I sent you this question, but it's my understanding, and I think you put this in your questions and answers too, that Department of Education is not allowing any remote learning this year. So that everybody has to be in 5 days a week full time. So the concern is what happens to those kids that have to quarantine, whether it's individuals, whether it's a group, that kind of thing. How are we gonna take care of that?
Yeah, great question, and you are absolutely right. They've said no remote learning. The DESE has said that, and that's one of the things that we'll work through. Hopefully, one of the things that helps us is some of the new testing, which one of the write-in comments was about the CIC group who we are actively working with. We've been accepted into the program. So there's a new test and stay model, which didn't exist last year. So last year, people were pretty much, if you were a close contact, you were home. And now there's a different flow chart. So which I'm not going to go into great detail of that. We'll put that out so people can read it through. But the goal of that is to keep kids in school as much as possible unless they are actually positive. So it should greatly reduce the number of quarantine that we have to do, that kids have to do, or adults have to do. And then right now, we're not looking at remote anything,
Okay.
but we'll
Alright.
keep that conversation alive and going, and we'll sort of, have to revisit that as needed, depending on what our numbers look like.
Okay, I'm thinking it's us and everyone else too that will be dealing with the same challenge, but okay,
You are right.
thank you.
Okay, Hillary?
So my questions are sort of follow-ups to Mary's and Elizabeth's. As far as the remote learning, if a large number of kids in a class, I know ideally we want to do the test and stay strategy, but I also know in states across the country that have already opened up, that's not really necessarily working. I have a friend whose kids, a third of the kids in the class were out the second day, half the third day, and by the fourth day, the whole grade was quarantining. And so are there exceptions to allow remote learning while a class is quarantining? And then as far as children who have really serious medical concerns, like I know in the past there was homebound instructions for kids that have significant medical issues that would be home anyway, not discomfort with COVID, but they wouldn't be able to go to school regardless. Those are still allowed, correct? And then my concern with the mask breaks and lunch is, I know initially they were saying that it takes about 15 minutes of exposure to catch COVID, and that's gone down to 5 minutes or less than 5 minutes. And so I have a hard time with the concept of we're going to have kids be masked all day long, but then they're going to take the masks off for 15 minutes and they're all going to catch it anyway. And I want to make sure, I understand all the limitations, but I want to make sure that we're really open to being creative about different issues. Like I know, for every idea, there's some caveat that makes it difficult, like going outside, there's bees, going outside, there's weather. But, we do have the ESSER funds and we're not hiring as many positions as originally thought of. So I want to make sure we're open to the idea of, renting a tent so kids can be covered and then going outside for mask breaks, or, paying to relocate the bees or kill them if they're wasps, or I want to make sure we're not, I know things that would typically be a non-starter because of these issues, that we're willing to handle some other issues in order to prevent potentially deadly issues instead.
So great questions. So some of them are a little bit easier than other ones. The homebound question, if there's a student who has medical issues, that's not a COVID issue. So we always have that, and they would probably start with their building principal and then Mr. Ferranti, Director of Student Services. And those requirements are still in place. But that's not.
They require what?
Go ahead, I'm sorry.
Sorry, I heard you say they require, but I didn't hear the next word.
They're still in place, I think he said.
Okay.
They're still in place. So you could still reach out to the Director of Student Services, and if you have a child who's homebound for whatever reason, medically, they get a doctor's note, we support that. There's tutoring available, and there's a whole protocol that goes in line with that. So that doesn't take that COVID and being on site and saying that we're not running remote learning doesn't take anything away from those kids. And when you reiterated, I think, the same question about could we do remote learning? What does that look like? So I think what the commissioner, my takeaway from what the commissioner has said is that he doesn't want us schools to revert to what we did last year with remote classes. He wants to keep telling us for time on learning, students need to be in the building. So that's the model we're using. To your point though, is anything a non-starter? We'll take it a day at a time and see. There may be circumstances where we need to be more creative than we originally thought. So nothing's a non-starter, but the path that we're following is using the information that we have from all these different bodies, primarily the Department of Elementary and Secondary Education, which is kids need to be in the building. So we're making that our priority because that's sort of the marching orders we've been given, and we're working with that. Mask breaks, we absolutely could look at different options. I here last year, and I would go back to the principals to double check that that mask breaks were a problem in terms of weather. They did it differently, they did it in different places, but we can definitely look at that.
Okay,
Good, great questions, and we'll continue that discussion internally.
Natasha.
So I know we have some other like outstanding questions, like our legal questions that are still being vetted. So I just wanted to ask Lydia, for you first, will we be able to have an opportunity to, at our next meeting, maybe get more information? Because I know it's kind of like rapidly evolving. Could this, I don't want this to be like the only time.
Oh, it's not, yes, it will
Okay.
not be the only time. No, this is basically, I mean, what Brian has presented is kind of going to be a living document because we're going to have to revisit it
Right.
frequently as things develop and change.
Okay, good. No, because that was really, I mean, things, as Hillary alluded to, you know, after school starts, like there's a lot of change
Yeah.
and of things happening. And so just to go back to my question, is that, Brian, actually I have a couple, so I'll wait, I'll ask one now and then go around. The not having the attestation form as a requirement this year, given that we don't have testing starting from day one, and looking at the information about the safety protocols where there is information, if there's no testing, there's close contact. You have to define what the close contact is. So it's the 3 to 6 feet over that certain period of time. I feel that there needs to be a little bit more structure, like from day one, right? Until we get to that testing point, if we're not there yet, what would happen in that first week when families come in? You know, do you expect that we would have testing starting day one?
Great question. So they just, as of today, they emailed back CIC. So we should have more information on the specific start date. We have applied for everything. We've been accepted into all the programming. We've been allowed to order, but we're going through their manager who they assign to us. So I should have absolutely more information next week on specific timing of that.
Okay, because that kind of changes the context of what my other questions would be. In the absence of testing in place, there are different like quarantine protocols that are necessary based on close contact. And so if that is not in place, I would ask that the quarantine, like pending, maybe in the questions, pending acceptance into the program, because that is a little bit different, right? You'd have to, like, there is not the test and stay option available. It would be maybe a whole class would be quarantining for 10 days potentially, correct?
I would not go with a whole class because there's still X amount of feet for X amount of time who would be turned to close contact.
I know in
It's not a whole class. Typically,
so
it's
in
those
Green
that-
Meadow, or in maybe an agreement, but I know that last year, and correct me please, and this might be different building and different classes also. I remember that part of the discussion was that we couldn't do full on site with 6 feet. We could do mostly with 3 feet, but in reading your FAQ, there is indication that that can't be necessarily 3 feet distance. There's no guarantee of, you'll do your best.
Correct.
So that ambiguity, if we're not able to maintain 3 feet, so there is going to be potential for close contact, and we're not doing an attestation, and we're not sure if the testing will be in place in the beginning. I am a little uncomfortable with some of that not understanding. I just feel like there's a lot of area for
Error.
I don't know, like, how are you going to track if there's a, like all of those things. A lot of questions, and I think it's, as you get it, this is where I think knowing the testing will help kind of drive that
Sure.
understanding for families a little bit better. So that would be kind of important. All right, I'll yield the floor back, Lydia, and wait my next turn.
Well, and I can respond to a couple of your comments if you want.
Sure.
So one being testing, we should definitely have more information at the beginning of next week, just in terms of time frame on that. In terms of the attestation form, I think so in conversations, we felt like our better option was to encourage families to do the self-assessment at home. If you're not feeling well, your child's not feeling well, keep them home, as opposed to filling out a form that really didn't get filled out all the time. And even when we double checked it, by the time we double checked it, student was already at school. So it really was sort of a challenge to make that a meaningful form. The goal being, really, if you're old enough, you're a high school student, how do you feel today? And if you're feeling fine, come to school, we want you. But if you're really not feeling well, we really do want you to stay home. And for the younger kids to really reinforce that message with the parents, and we will send, communications to that point, so that it's not a form that you're filling in a checkbox that you're doing, but you're really doing that at home, and that's hard. And even before COVID, that was hard. So just that's the thinking behind that. And the other thing that you started, it absolutely, this document will be a living document. As we learn more and do more, we'll add to it and we'll clarify, and there may be things that we didn't even think of that need to be on there yet.
Okay, thank you. I have a question. This has been raised by a few different people, and I raised it at policy whenever our policy meeting was last week, or the beginning, I can't remember. Anyway, it doesn't matter. I am concerned about the students who and Jeff may be the one to address this, and he did try at policy, but I am concerned about the students who require the ability to read lips and see facial expressions as part of their learning, because they have developmental delays or whatever other issues. And that's the one thing that I seems to be a major obstacle, and is actually a violation of FAPE from what I understand. If we're having masks on everyone and kids need to be able to read lips in order to progress and access their education, how do we accommodate them?
Well, every child has their own individual strengths and needs, and that's what we discuss at the IEP meetings. And we've existed all last year with the highest needs kids coming in who had masks, and when everyone else came in at the beginning of April with masks. So it would be very individually based, but we have not had any concerns with that situation. And I don't anticipate that, even if we had some new families move into the district.
Okay. I have received direct contact from a couple of families who it is an actual concern for, and so that, I guess that's why I'm bringing it up, because
I think it's great that they're comfortable bringing it to you, but if it doesn't get to the principal and me, we can't do a whole lot about it with the team meeting process. So I would just encourage you, if you or anyone else on the school committee gets those type of concerns, you encourage them to use the building-based process and the IEP process, so we can take care of the kids. We can't address what we don't know.
Mm-hmm. Okay.
Lydia, CPAC, just to mention, CPAC has received feedback as well. So just wanted to add, it's not just the school committee.
Okay. All right.
I would just second what Jeff said. So if CPAC gets information, or by all means, hopefully they will pass that information along, so we can do what Jeff referenced, with really meet everybody's needs.
I'll wait till my turn to comment.
Okay. Yep. All right. So Elizabeth, back to you.
Okay, so back to what I was talking about before, and then picking up where Hillary left off. So there are creative solutions to the problems of lunch and to mask breaks, right? And I know you said, that the recommendations don't require outside lunch, or being more creative about those things. And I know you said you're in continuous talks about them and you're taking it a day at a time, but it sounds like that's a very slow process, and it sounds like you're resting a lot on recommendations and just going exactly as far as recommendations go. And I think that we can do better than that, especially, again, if we believe, and it sounds like you do, you just recommended that we have masks all the time. If we believe that that is what we do, then we should find a way to make the times when they have to take their masks off also safe. And we are running out of time. They start school in 2 weeks. So, even if we use some money to buy some umbrellas, get those kids outside so they have mask breaks. I mean, it doesn't seem like it is such a huge undertaking that we can't do something to ensure that the mask breaks will happen outside. And it doesn't seem like there's nothing we can do besides putting kids in cafeterias for half an hour at a time, when we've already heard people say that this transmits in less than 5 minutes. So I think that if we're going to do this work, we have to do it. We have to do the whole thing instead of doing some of it as the convenient part, instead of being creative. And that worries me a lot, that we're not taking more steps now. We're not having more impetus behind us. So do you have a different view of that? Is there anything I don't know there?
We work really hard to make sure that we get everybody in the building, that we feed everybody a couple of times a day, that for mask breaks, we find opportunities for them to take mask breaks, preferably outside or in large open spaces with doors that can be open, so that they're not, subjected to bad weather, if you will, which is not uncommon in New England. So it's not that I think we're sitting on our laurels. I think we're trying to be realistic and reasonable with what our options are and how we maintain the school. And I hear everything you're saying, and if you have a suggestion, I'm open to hearing that. Absolutely.
Yeah, I think we should have, again, like I said, I think that they're, asking kids to bring weather appropriate clothes to school and anticipating they're going outside, even if it's raining, is a reasonable request. Giving kids umbrellas if they don't have that, finding ways to make sure people can do what they need to do. And then, I don't know, with lunch, it comes down to things like maybe sack lunches, maybe making sure kids can sit outside, finding spaces that are appropriate for kids to sit outside. There are people who are doing this work, and it is possible around the country. People are doing these things. So I would like to see us doing the best we can. So yeah, if you want, we can talk more about that. I know we have more meetings, but yeah, I think that that's something we have if we understand ourselves at the moral obligation to mask the kids in the building and recognize that we want to keep them safe, then we need to do that all the way. But my question is, I'm curious about the staff, really. So a couple of things. Have you spoken to the unions about vaccine mandates? Number one, and on the flip side of that, is there a point? So last year, schools sometimes shut down because so many staff had to be out that they couldn't keep school going because there's usually a shortage around. So are you thinking about that at all? So both, are you talking about the vaccine mandates, and what are you thinking about the possibility of having to shut down because we lose staff to sickness?
Yeah, great questions. I mean, luckily we didn't have, and I don't know that Massachusetts had too many issues where schools themselves had to shut down. There were absolutely some, and they would typically, and anyway, it did happen a little bit, not a lot, given that most teachers have had the option to get vaccinated, and I would say many, if not most, have, but not all. We're in a better position so that won't happen for the adults. And we have not made or had conversations about mandates for vaccine. It's not an FDA approved vaccine at this point. I myself would not want to be in a position of mandating something that's not approved.
I mean, a lot of places are doing that. I mean, the state is doing it. Other workplaces are doing it. So it's not, we wouldn't be alone in that if we did that. Okay.
Okay, Mary?
I'm good with that piece. I didn't know if we're also going to have an opportunity to ask about the CIC health, that whole provision. Is that a separate conversation, or?
We're still waiting for information, aren't we, Brian?
Yeah, it would probably be worthwhile that at our next meeting, or to have a meeting next week, to go over that when we have a little more specific information. I'd be talking pretty generally about it, and I think it'd be better to be able to give you the specifics of that, because I think that also helps tie back into Natasha's questions when she knows some of those answers. I think that will help.
Okay, yeah, it just, my main question was about whether we were going to need extra personnel, to hire extra personnel to,
So that one I could answer, simply because when you fill out the application, one of the options that you have is to ask for staff from them to do the testing, transport it, et cetera. And we ask for full support in all three modules. So I can say, yes, we did ask for that. And we've been approved and accepted into the program. Now we're starting to work out the details. We just haven't got that far yet.
Okay, thank you.
Hillary.
Okay, I have a lot of quick questions as follow-up to things other people that you've said to other people. As far as the days for learning needing to be in person, do the days to count towards the number of days that are required? Is that impacted when a class needs to quarantine? And then for the testing, I don't know if this is general enough for you to answer. Are we looking at testing when people are symptomatic or have contacts, or are we looking at preemptive regular testing, weekly or something? And then I have some concerns special ed wise, that we really sort of in the policy where we say exemptions for kids that wearing the masks aren't safe. I want to make sure we make sure we meet the needs of the kids that have special ed needs so that we're not making education inaccessible to them. And then I know schools have been having trouble finding substitutes during COVID, and I want to make sure we're not regularly pulling paras away from kids that need them to fill in as substitutes, and that we have a real plan for, I was pretty shocked when I saw how little we pay substitutes. I don't know that I would do that job for that salary. So I'm a little worried about that and how many, if we'll, communicate with parents if the kid loses the para for the day and then actually make up what they need, and things like that. And then as far as what Elizabeth said about talking to the unions, I understand the hesitancy to require vaccines before the full approval. But I know my union, we had a meeting, info from my union today about the state mandate for employees. And it seems like when we could start negotiating and talking about areas of concern with the union prior to that FDA approval, to sort of cut down on timing. And then back to the lunch thing, I know my biggest concern sending my child to school is taking off the mask to eat. And to the point that if I could anyway afford keeping her home, I'd keep her home. So I really want us to try as much as we can to make that safe. I know it sounds like we're harping on it, but I just feel like if I have this concern for my kid, there must be so many parents that also have that concern for their kid. And we can do so much during the day. And then if they all take masks off with 100 kids in a room, it's well.
Yeah. So you raise a lot of really good questions, and there are absolutely gigantic challenges with this model. And there's some of what you've asked about in terms of testing. We applied for all the testing. So that would include the stay in test model. That would also include what used to be called pool testing, which is now got a different name. But again, that requires parental sign-off. And in order to make sure it's actually effective, you need to hit a certain herd immunity, which we haven't pulled everybody yet because we're waiting to work directly with CIC to follow their protocols. How do we do that? What are the forms that we need, et cetera? And we should have that by the beginning of next week, and that should help move us in that direction.
Would the consent to test and stay be the same consent to do the preemptive weekly testing?
That's a great question, and I don't know yet. I haven't seen that form.
That could be helpful.
Yep, that would be great. And but to your point, when you asked that, it would make sense that if you're okay as a parent with your child being tested for test and stay, you would probably be okay with them being tested to be part of the pool test. So it's that person is probably going to say, okay, I want to participate. I want my child to stay, etc. In terms of the special education, and really it sounds like an accessibility question. I don't want to put that, words in your mouth, but that's kind of how I interpret that. And I know that Mr. Ferrante is aware of that and always on top of that, and really making sure that we are making education accessible to all students. And he's absolutely, I have, I'll show you, which is not the end all be all, but I have this mask. So if somebody needs to see, you can actually see me, but it fogs up. But there are tools that you can use to help with that. But so there are even some simple things that we used last year that will continue. And there were some things that we used that might not have worked well, but we were better at. But so we are aware of that. And again, if people have specific And I think this is what it comes down to often with special education. You have a specific concern because it's your child and you know them and you know what the concern is. Reach out now. But, don't reach out to Hillary, reach out to Jeff or reach out, Mr. Ferrante, or the building principal. So we can really start to problem solve that before school starts. So I would I know Mr. Ferrante said that and somebody else as well, but please reach out to us so we can get that in motion in advance. So we're set on day one. Unions, we've met with the union. We have not broached the subject yet of vaccine mandates and we can, it's just sort of, it's a little the cart before the horse. It's not out there yet. And there's only so much time. And in terms of meeting with them, I want to make sure we're maximizing the time we have together. I'll do a little homework on that one, if I may, and I'll get back to you.
Okay, Natasha.
Lydia, this is first for you. I think the mask situation, what you're talking about, I'm hoping that we can address that maybe in the mask policy potentially when we deliberate on that. So I don't want to lose sight of that discussion. I think reading the policy, I think there might be an opportunity for us to think about that. Brian, I think one of the things, just hearing you and Mr. Ferrante talk about feedback and having people reach out to you or to Ms. Ferrante, the building principal, I think sometimes what happens is they may have already, and obviously not have received a favorable, in their view, what meets their needs. And right now, everything is, these are talking about people's children. So this is a very highly sensitive and understandably emotionally driven conversations about their kids' access to their education, their ability to thrive, their ability to interact with their peers. So I think there have been attempts. I don't want to jump to the conclusion that parents have not reached out. I just want to make sure we understand that usually it is the case where we may have heard something after parents have reached out and they not are, it's Maynard. This is part of Maynard culture. We are, we're friends with a lot of people and so people do reach out to their elected officials pretty easily. So I just wanted to clarify that with, first, that there was an understanding that people automatically reach out to us first. Sometimes it is a case, but most often it's the fact that they've tried, because I think many of us do encourage, have you check with the principal, have you check with that? And so just for clarity's sake there. So now to my question about the makeup of how all of these policies came up. Just listening to the comment that we had. I'm curious what was the composition of folks involved in putting together these policies or these protocols that you've presented to us in the community?
So is that the back to school plan, that document?
Yeah. I'm just curious who the stakeholders were that really were involved, so the community understands like all the different folks that played a part in these, because it's a lot goes into it. So
secondarily, kind of from a distance, would be CDC, DPH, more closely to us.
Locally.
So go ahead.
Locally, meaning like in Maynard Public School or, who are local stakeholders that helped put this together.
Our Board of Health, other superintendents, our administrative team, the Department of Elementary and Secondary Education, and then us doing our own research within the wider bodies of CDC and DPH and the American Pediatric Association. And then really putting together, what do we think that we can do and how do we do that? And so what you see is really a lot of superintendents working collaboratively. This is, honestly, if you start to look up different systems, this is what you see. This is what superintendents, we've been in meetings since, I would say, end of July, when things kind of shifted a bit, to really make sure that there was some continuity between district to district, because the state certainly wasn't willing to do that, nor was the commissioner. So the superintendents have been meeting and talking and working on documents that look very similar to this.
And the reason why I'm asking is because I know that this is going to be a really evolving process, like week to week, things changing. And I know last year you had a really solid task force, internal, like they're very defined folks. I would like to know, like, who is that? Who are those people that are going to be, like they're vetting all of these changes and how they're impacting the building. And I just want to make sure that the nurses are part of that conversation at each level, because that's important, I think, for myself and also the community to have reassurances that the nurses are on board with what we're recommending and what we're voting on, and that they can implement it and follow up. And if there's hesitation in the nursing, it makes me a little uneasy to see how this can play out.
So absolutely, nurses were invited to every meeting we had this summer. They didn't always choose to come to every meeting, that's okay, but they were included in all of them. And I'm sure once school is back in session, I would anticipate that they would again be part of that group. They were last year. But even when they weren't there, we had representatives from town's board of the town's nurse who works with our town and surrounding towns, who's equally qualified and know this is what she does: contact tracing, giving advice, working with, for example, she works, she doesn't, but her counterpart does the same thing in Concord, Colorado, so she's able to talk with them. But we're getting that information and that perspective. She, in fact, was very supportive of the CIC program and said you should apply, absolutely. Whereas last year we weren't there. We had lots of conversations and we didn't push and move in the direction of pool testing. And that was also at the support of that group. So that group continues. We've just, as we've seen, things have evolved. And so as this year begins, we'll have nurses, we'll have administrators. Mr. Ferrante for special education is absolutely a key member of that group. Assistant Superintendent Gaudette, Charles Braun, if he's still on here, who's on that one as well. So it's a very solid group with experience in a variety of areas.
No, I thank you, because we hadn't really talked about it that much, and I just want to make sure that there's that solid, ready to go. Like, people call the alarm, and it's made up of a good slice of the needed folks.
Yes.
Yeah, and then oh, Lydia, sorry.
That's okay. I've actually forgotten what I was going to ask.
I had a clarifying point
Go ahead.
also. For the homebound instruction policy that was referenced, I would suggest that reference to that be included in the FAQs as my preference, because although that policy exists predates COVID, there could be students who do get sick, obviously, from COVID, who could be out for an extended period of time. We've already received, as a school committee, feedback of stories through our internal. And so I want to make sure that parents are aware that that falls under the extended illness, that whole ability. And then just to clarify also that nothing precludes Maynard from offering remote learning as a means to access education under that policy, IHBF. If Maynard, it's not offered as an option, right, for anyone, like I want to opt into remote learning, but if there's a medical need that is an extended absence, nothing ever precludes a school district from offering, because it's, as to Mr. Ferrante's point, it's individualized needs, right, for kids who are on IPs or whatever. So I know as a district, we have outsourced some of that in the past, Carewell, whatever the vendor was, but that does not mean it can't potentially be revisited as an offering in the future, correct?
Well, typically that is done, depending on the situation. I've seen it done most commonly through tutoring. As we learned last year, doing remote learning is challenging, and it changes. If we think about what a teacher has to do, it is not the same. And I'm kind of like you, Natasha. It's kind of funny. I was like, well, can't we just do remote learning?
I don't like it either. I don't like remote learning, so I'm not advocating for that. I'm thinking of the kids who cannot be in for whatever reason, not for a parent chooses to keep them home. We're talking about like medical need, that we're thinking about social emotional. you know, and keeping them integrated. That's what we're talking about doing for this year. I want us to be creative and say, you know what, that tutoring, here's a packet option may not work this year because we have other needs that are compounded for kids to engage. They may have been out for part of last year too, you know, and so social emotional need is equally as important, you know, in accessing their education. So I just want to keep that at the forefront of that discussion. When we are talking about the potential reason a child might be out for an extended period of time medically or whatever that is, that's not precluded from us under those circumstances. And I'm sure there's other operational things you'd have to work out and you know, whatever, but just want to make sure we don't rule it out unilaterally as a potential consideration if needed. All right, Lydia, I yield to Lex, sorry.
Sorry, so, because my idea, whatever I was gonna say, went out the window. I'm gonna go around one more time. If there are any final comments, questions, and then hopefully I'll remember what I was gonna say by the time you guys are done. Otherwise, we're just gonna move on.
Okay, I start.
Yes, you do.
Okay. I heard when we had our parent forum a couple of days ago, a lot of people, no matter what their feelings of masks were, they were asking about mental health supports. And so maybe it'd be a good idea to speak to that since we're kind of talking about special ed already. And then I'm hearing, maybe it's also just me, I'm a little unclear about when the testing is going to start. And so if maybe you could talk about the testing a little bit more so as we have a clear idea of what's happening with the testing, how that's going to work. And oh, one more thing, basic. Is anything changing with basic?
What's basic?
I know, you might not know, but I was wondering if you know.
What? I'm not trying to the question is anything changing with basic?
Like, are they doing something more outside stuff than they did in the spring? Are they doing some other mitigating factors, given that some kids who are coming into basic may not even go to Maynard schools? Like what kinds of things are they going to have to adjust if they, given that are they going to have a mask mandate also? Does it carry over to the after school program if we have one for the school day? Just anything we need to know about basic.
I can follow up on that one just because it's not our program, but I'll actually follow up with them on their protocols. In terms of testing, again, we'll follow up next week. We know we've been accepted. We're just going back and we really have not ordered yet, so we need to find out next week. I'm sure we'll reach out tomorrow. And when we have an update, as soon as we do next week, we'll update the school committee on testing and when that will begin and what that'll look like.
Okay.
And mental health, we have spent some time talking about that, and our guidance counselors did a phenomenal job last year. One of the other pieces that we are looking at is incorporating, I'll sort of like spill the beans on this one, but I don't know all the specifics yet, but it's incorporating yoga into our school system at different grades and different ways. We had PD on that, and we got a proposal, and we've been working with a local yoga, I'll call her a yoga master. That's probably not exactly the right term, but I think she is a master in yoga, and it's more about, so what I'm learning is that it's about breathing, it's about relaxation, it's about how to deal with stress and we all have stress, adults, kids, everybody. So it ties nicely into the mental health component of what we can offer. And I'll be able to update you, and I will even invite her to an upcoming school committee meeting. We've been sort of going back and forth on fine tuning exactly what the proposal looks like in terms of programming and at what grades. But she can give you a very good overview of what the program is and the strengths of it and how it ties in. So I'm excited about that. I'm really excited because I think that could be something that is just fantastic for the students and staff of Maynard. And I don't know that everybody does that. So it's a really exciting offer, and it's a local, it's a parent, she's a child in the system, and her business is within is in Maynard. So some of you are clearly smiling, so you know who it is, but I'm glad. So I will invite her to the next meeting, and that'll give us time to kind of finalize that. So I think that's a nice connection to the mental health. It's a great question, and we will keep exploring more and more for mental health and share more. And I'll have the guidance counselors be able to come and share with the school committee as well. They did a lot of really good things last year, very consistently throughout the whole year, and they will do a better job articulating what they did at the different levels.
Okay, thank you. Mary Branley?
It just follows up on the whole contact tracing thing and that, and it just is, just again, I know that the contact tracing you said didn't work last year, but just to reiterate how important it is to have something in place, because if we lose the first 2 weeks, we're history.
Contact tracing worked just fine. I don't know what I said, but I didn't say contact tracing.
The form.
It wasn't foolproof, yeah.
It wasn't foolproof. Some of that was us internally, and some of that was even when we corrected it, if you will. So if I'm a high school kid, the correction was we called you down to the office to have you fill it out, or we called the teacher and had you then do it from probably 6th grade on up. But by that point, you've already been on the bus or you've been at school and you've already been around a while. So what we're trying to do is really encourage that level of just self-awareness before you leave the building, before you leave your home, before you leave your home and come to school.
Okay, all right, thank you.
Hillary?
Okay, so the mask policy that we have the draft of, that applies to the school facility, right? So regardless of who's in the school, meaning basic or sports or whatnot, it applies to everybody.
Correct.
Okay. And then when you talked about working with the town board of health, is that, I believe Kelly is the medical person, or is it the non-medical people in town that you consult with? Like, I want to make sure we're consulting with the medical person.
So it's Kathy, and Kathy's a nurse.
Okay.
And it was Kelly. Kelly left.
I think
No,
Kelly
Kelly's-
Callow is the interim who's in Hudson, the health agent is, I think,
Yes.
right?
So the person on our group is Kathy, and she's a nurse. And she's contracted by the town, but works with us as well on our task force, if you want to call it that, to give us advice. And she's one of the people that helps with, or I should say, manages and does the contact tracing for Maynard.
Okay. The task force, is there someone from the school committee on that? And are there parents on that?
No, that's an internal group.
Okay. I know we've gotten some really great emails from a couple of parents who are citing peer-reviewed research and who work in medical fields and stuff. So I know it's kind of funny when like even DESE or the school department are non-medical people making medical decisions. And so I know we have a great community with really educated medical people that we could probably rely on for some of that stuff that's outside. I'm a scientist and it's still outside my area sometimes. And then I just wanted to make sure, I know in the past there's been pressure on kids or different sort of peer pressure techniques of trying to convince kids to increase attendance. Like a chart to, give awards, like attendance awards and charts on that. Is that all squashed for now?
Honestly, attendance is still really important. Not only, we know it's important because we're educators.
Yeah.
Or you're a teacher, or you're an educator, or you're a parent. So we know attendance is important. DESE has put a pretty high focus on attendance as well as of several years ago, which is why you see what you see at the building level across the state. Principals trying to get exciting and do neat things and sort of some, to get kids to come in, and that typically works. The benefit is it typically correlates to kids doing better in school and being more involved in school. And as they go along, more kids graduating, and that's kind of the goal, right? We want kids to graduate high school and be productive citizens.
Well, I know increasing attendance helps academics and stuff, but I don't know that pressuring kids to come to school helps increase attendance or is appropriate in a pandemic. Like, I don't want an 11-year-old thinking, well, my throat hurts, but a little bit, but it's not that bad. And my stomach hurt when I ate, but it didn't hurt when I wasn't eating. So I'm probably okay. And I want my class to be, high on the chart. Like, I don't want us doing anything to pressure kids into coming to school when they might be getting sick.
And I want to
piggyback
on that because I do know that there were a couple of kids in previous years who were out for a few days and then would get pulled aside and spoken to about the fact that they were out. And then in the future, when they were sick, they were really scared. they were like, had anxiety about coming back into school because they were gonna get taught to again. So if,
I don't know that specific situation.
no, you weren't here. You weren't here.
What I'm
So,
saying, I can see as a former teacher or principal, I wouldn't want to check in with the kid, like, are you okay? And it's not necessarily all about attendance, but I'm making sure that they really are okay, because I want to know, I want them to feel that they belong. And somebody noticed when they weren't there. To your point, I don't know where you moved away on my screen, but there you are. And Lydia, absolutely, we don't want to encourage kids unnecessarily. We want to encourage them appropriately. We don't want them to feel bad. If they are sick, we want them to stay home. Absolutely. So there's a nuance there, and I hear your concerns there, and we can address that.
I think it's even, if somebody, I know I kept, my daughter was sick one day and I knew it was from dehydration from being outside all day the day before. But, I want people to lean towards okay, my kid has a fever and they don't feel good. I don't want the next day to be like, okay, well, maybe you should have come if you should, I just want to make sure we're being responsible.
Yep, I agree with you.
all right, Natasha.
Water fountains, right? Those are still a no-go, correct? So it's the water is bring your own water still, and water bottles will be available at the school, correct?
For the time being, yes.
The time being, yes. Okay. So what are you thinking why it would not be?
If things change, I mean, as we've said, it's a moving target. If all of a sudden water fountains are acceptable and safe and there's no concern with them, then we would reopen them.
Oh yeah, no, I'm thinking like for day one, like starting off, parents.
I was agreeing with you.
Okay, yeah, so starting off day one, in their mind, parents just need to kind of pick up where we left off in the spring, that don't assume that there's gonna be water fountains available. Bring enough water for your kids all day, because I know there was challenges in the spring when kids weren't even there kind of all day, and there was water and maybe not enough water and on days that were hot. So I just want to make sure now that we're going to be full-time, every day, that I just want to make sure we're prepared to have a lot of water on hand. And because kids might not be bringing multiple water bottles, I don't know how that's going to work out, but I just want to obviously hydration is critical, and access to water is important for everybody. And I don't want to be, I'm already considered a child abuser, and I don't want to be depriving kids of their need to sustain water. So, and then thank you for just clarifying that. And then the other part, I just want to make sure I understood about the in the guidance that you talked about. Actually, is the first part about the exception for spacing. An individual works alone or in a segregated place. I just want to make sure I'm understanding that a little bit. So working in a segregated place could mean with students potentially. So are we saying that, I just want to understand the intent here, is it that they are working alone in a segregated place or a segregated, so there could be multiple people in a segregated place is what I'm trying to say, because the way it says or in a segregated place.
Then they would be masked there if there's
Okay.
If
Okay.
there's one.
Okay, so it's when an individual works alone, and then maybe it just take out the or and just say in a segregated place.
Is that a reference to the central office? Because you guys are all together, but you're in segregated areas.
Well, right, if you're in your office, you're segregated and alone, right? So I'm thinking that I'm thinking in the classroom, Lydia, like in the you could be working, like whatever, but you're not segregated per se. Because the way it has or, so I just want to, I didn't know if that could be. I would think it's both, right? Yeah, when I read it, it just made me think that, a segregated place might be multiple people there, and you might not be necessarily alone. It could be two people there, because the way it says or. So if whatever the intent was, if it's that one person by themselves, then I would take out the or.
Okay, thank you.
All right, well, I don't remember what I was gonna say, and I don't have anything additional. So I'm just gonna have to let you move on.
All right. I have a few more things within that report, which I know I'm a little over my time, but it's kind of one of those years where.
It's one of those nights. It's fine.
Tonight, maybe next week, even the week after. MSBA update, which is not nearly as exciting, but it will become equally exciting because it does potentially lead to a new elementary school several years down the road. So just to let you know, we are continuing with our committee work. Our building committee, we had a owner's project manager subcommittee, which we in turn went through the process and hired an owner's project manager, and now we have created that subcommittee did its job. We have a new subcommittee for the designer selection. There's a designer selection subcommittee, and that's been put together. We're looking at advertising at the end of this month. Proposals will be due to our owner's project manager, which is Colliers International. We'll be doing a walkthrough of the Green Meadow building at the beginning of September. There's a designer selection meeting in mid-October with the Mass School Building Authority, and interviews for those selected design firms would be at the very beginning of November. And I will keep you updated as that goes along. And several of our school committee members are actually on the building committee as well to keep the flow of communication as smooth as possible. Business office reconfiguration was sort of, I'm going to do a high level overview. It was kind of a nice, healthy discussion with the budget subcommittee, with that group, and we're talking through as we did some review of our internal systems. We recognized that, and we learned a lot actually about our business office and who does what and how many tasks each different person has, and they're running at that many different people. When I say that, it sounds like it's a department of 15. It's really, right now, it's a department of 2, which isn't quite enough. We have a lot of employees. So in reviewing, we recommended adding a position, and we sort of talked through specific job descriptions on job responsibilities for each of the people. So it was clear what they would be doing. And one of the things it does a lot is it also does some co-training. So we're not in the position of having all of the knowledge of certain aspects of the job with one person, but it's divided up. And if somebody's out sick or quarantining or whatnot, we're not stopping business. We can continue right along in a healthy, effective manner. It also became evident that some of our former employees have worked really long overdue, hours long over past what is expected, if you will, within the workplace, because they wanted to, and they were in a position to do that. And in all fairness, we just know and recognize that we needed to add a person to complete that office to be able to work effectively. We looked at a variety of models, just so you're aware. We looked at consultants, we looked at part-time, full-time, grant funding, or making it work within the operating budget. So we really took a step back and reviewed the whole process and came up with what we think would be the best option for the district moving forward on a permanent basis in terms of building capacity within the business office. So we're excited about that. So I don't know, Natasha, I don't know if you want to comment on that. You were one of the people that was heavily involved.
No, thank you. And I'll say a couple things because I did have a couple notes, and I know it was kind of like a really evolving fast conversation, but I wanted to just highlight what you talked about, the duties of 2 people. Like, they're paying all the bills, they're doing payroll, they're setting up new vendors. There's a lot that just 2 people were doing. And so I think Brian and Wayne, very thoughtful in this approach. Mary and I did ask a lot of questions about other alternatives that might be more cost effective, but it wasn't going to meet the needs of all the functions that were available. And just to clarify also, Brian, we actually already understood it would be a 0.5 FTE. So what we're saying is we're not adding a full, it was increasing that 0.5. We already understood that would be just for grant. And we're just creating that as a full-time FTE, but instead of being funded through the ESSER, we are absorbing this in the operating budget, considering it as a long-term investment, because they will also be looking at, I know we were talking about Medicaid reimbursement. So I just want to clarify, right? I haven't lost that, right? So it's not one FTE on top of the 0.5. This is actually just, you had presented the 1.0, we went back to the 0.5, but then after reevaluating, it's felt that the 1.0 really met the operational needs long-term. And this is not an increase, it was through attrition, so it wasn't an added expense from the budget. I also wanted to call out something which you did highlight in our report, but as of FY21, the town no longer has to incur expenses for Excel staff benefits, because we've contracted out beginning in FY22 basic for services, and that's an annual savings of over $89,000 for the town. So I just didn't want that to get lost in the conversation on it's not, there has been shifting there as well. And I also want to highlight, there was a comment made by the select board the other night, and I thought, you know what, this is really fitting for our scenario. But it was in relation to the health agent, expanding that position to a one full-time FTE. And the comment was, I think we need to start building into the budget. We look at Maynard as a small city. We are unique in so many ways. One of the ways we are unique is our needs. We have worked really hard to keep our FTEs at a bare minimum, and we did that for a while. But duties are carried over by other people, and those people are not able to working on building us moving forward. And in that relation to that conversation, it was more of an investment to allow us to grow as a town. And I think that really carries over a lot to our conversation in our school. So this position will allow us to look at grants a little bit more, be more financially sound, increase potential offsetting revenue opportunities with Medicaid. And so I do think that it should be viewed as an investment to our school district. So anyway, that's all I say. I don't know, Mary, if you have anything else.
Yeah, just so Colleen had made us aware that we actually have been cutting positions at the administrative level too. We had we'd cut a position at special ed administrator. So and the other piece I would say is sometimes we're penny wise and pound foolish, in that if we don't have the right people in position to do the full job, we're losing out on opportunities like what we were just saying with the Medicaid and that. So and also if people leave, then we're not losing out on reporting to the state and things of that nature. So we have to start really standing up for ourselves and the value of our people. That we get a lot of feedback that we're top heavy, and we are not top heavy. So that's all I would add.
Colleen, did you want to say something?
Yeah, I just wanted to make one correction. Mary had said that it was an administrator. It wasn't an administrator, it was an administrative assistant. These are support positions we're talking about.
Thank you.
Okay.
Well, then the last piece that I was going to comment on, and then I really will be done, would be the success centennial celebration. So that's
Yes, and Jen Piccarelli's here to talk if we have any questions too, just so you know, she's here.
That'd be great. I see her on my screen. Hi,
Okay.
Jen. I did reach out to, so specifically regarding just the fireworks on Saturday, October 2nd. There was some concern about the Fowler Field. They reorganized to say, could we do it at the field behind Green Meadow? And I've spoken with both the Chief Noble, Chief of Police, and Chief Sowers, the fire chief, both who have said that's a great location. They're happy with that. And then they got into some detail about the safety and distance from this and that, and they are very comfortable with that as a location. So I wanted to bring that forward to the school committee as well. And if you do have, the chair is correct. If you have specific questions about the event and the celebration, Jen is the person to ask, and she will answer that. So I think we're good on the spacing of that field.
Is there a rain date potentially, or is it, I don't know if that had, no. Been a rainy year, that's why I'm asking.
Colleen, Jen is muted.
Yeah, so basically what we're gonna do is we're gonna do this in conjunction with the Maynard Fest, which is on October 2nd, which is a Saturday. So kind of like if you've been in the town for as long as I have, they used to do the Maynard Fest in the morning, and you'd have that until about 3, and then you'd have about an hour-long break to catch your breath, and then go into the nighttime portion of it. So we're kind of just bringing that back, but it's the Sesquicentennial Committee would be handling the fireworks. So it would be kind of 2 different entities, but we're joining with the Maynard Fest Committee at the same time.
Thank you.
Hillary.
Is the fireworks at the field behind Green Meadow, is that where they're being set off and people are watching them from other areas, or is they're gathering at that field?
Yep. So originally because I did not realize what we had done with the Fowler Field. I knew that there was work done to it. I had no idea how extensive it was. And so we were originally going to ask to use the Fowler Field, but obviously they didn't want to set off explosives in that area. So we started looking at other options, and Chief Stowers and Justin DeMarco of the DPW were fabulous. They looked at other areas and came up with that field. So I think I have to confirm with the company that we're going to use, but I think that the best viewing sections would probably be Crow Park to gather there and watch, and probably the Fowler Field if people were able to sit on that, because I don't think they would damage it. But if you tell me that they would damage it, then I'll make sure that I tell people not to sit there. Ideally, what we wanted to do was originally use Fowler and then have people sit in alumni, figuring that that would be, they could utilize parking areas there. And it would be nice to have everybody in like one huge location to keep them all contained for safety issues. And they may still be able to do that. I can get more clarification once I call the company back and talk to them. They can tell me where, how they can shoot them off and where they can go and where the best viewing locations will be, so that I can give everybody a heads up on where people will be located.
Thank you. All right, we good?
I just want to say thank you for doing it. And also, I think that sounds like a much better location than the last couple of times when they were on Crow Park, which was terrifying. So
Yeah,
I'm glad
I
that
guess there were a lot of people. I understand that it must have been, I don't know if it was the crowd that was bothering people, or the noise level, maybe because it's closer to houses.
Mhm.
I don't know, but I heard there was a lot of issues with it last time. So it sounds great that it would be in the back. There's not a lot of houses in the back where Green Meadow is, I guess. So hopefully that would be a great location and nobody would be bothered by it. We'll definitely publicize it
Mhm.
a ton so that people are aware if it's something that bothers them and they want to get away from the area for the evening. We'll definitely let them know and be very sensitive to that fact.
That's great. That's great. They thought of both sides, that people can get away from it and also that people can gather and watch it. So thank you so much for doing that.
Yes, yeah, that, and people, I know that people with dogs,
Yeah.
that's something that's sensitive for them too. So we'll let them all know.
Thanks.
Jen, I think also, I remember at one point, I don't remember whether it had to do with a couple of years ago, I thought we had it that people could sit in front of Green Meadow also, because then there was plenty of parking like at Fowler and that people would just walk down. So that's another possible opportunity.
Yeah, definitely. I mean, we definitely have great school lots and parking areas. So I think we could definitely utilize that. I love having the schools included in it, because it is part of the Sesquicentennial celebration, even though it's part of the Maynard Fest, but it's something that the Sesquicentennial wants to give the town. And I just think it's great. I also think going into the fall, that I think it's a great way to, give people smiles before we end up in the fall and probably a little separated, more so than we were for the summer. So I think it's just, a great idea all around.
Thank you very much, Jen. And thank you for sitting through the last almost 2 hours of us going on and on. But
I took notes. Thank
all
you.
right. And now, Brian, you are complete with your report? All right.
Back to you, Madam Chair.
Chair's report. So Colleen, can you unmute Kathleen Fitzgerald, please? Mm. Colleen?
I'm here. She should be able to unmute.
Oh, there you are. Hi.
Hear me now?
Kathleen Fitzgerald is the chair of the Human Relations Committee in town, and she and I spoke about getting, creating a relationship, and she wanted to introduce us to the Human Relations Committee and its mission. And I thought that since diversity, equity, and inclusion is such an important mission of ours, that they could also help us with that. So Kathleen?
Thank you, Madam Chair. So I really appreciate the opportunity to introduce myself and to talk about the work of the Human Relations Committee. A committee member did suggest that I come and talk to the school committee and to community members through the school committee. And so that's really what I'm here to do, is just to let people know about us and to invite you to our meetings. So I'll be brief because this is, I know, a long meeting. Just our stated purpose is to promote human rights, personal dignity, and positive relations between all residents and visitors to the town of Maynard. And we've got a long and sort of robust mission statement, but a couple of the points that I want to sort of point out to all of you are the following. We are to promote community policies and practices that encourage equal opportunity and equal responsibility for all people, and publicly challenge any practices in our community that represent prejudice, intolerance, harassment, or discrimination. And so those 2 points in particular, we really need to hear from the community. We need your voices to do that well. And so we really invite people, especially people, the unheard voices in the community, to come to our meetings. We have a Facebook page, but also the town website has more on it, actually. So we add a lot to the town webpage. And so we would love to have you. Our next meeting is September 20th. And we meet on Monday nights. And just to give you a sense of our some of the work that we do. So at our next meeting, Jennifer Rifkin Taylor is coming. She reached out to me about coming. She's a community member. She's gonna talk to the community about how to fill out the fuel assistance application, which I believe is a state thing. And she just mentioned that she does that at her work and she knows how to do it. So she wanted to offer it to the community. So I'm gonna try. So I'm glad to have this opportunity now to promote that. So people who don't realize you don't have to be at a certain, I think she was saying that more people are eligible for that than no. So the fuel assistant application we're going to be talking about. And then Sonia Ali might be coming. She works for the Islamic Center of Boston and Wayland, and she wanted to share with us some of the anti-discrimination work that they've been doing. And so recently we've written a letter in coordination with the select board on the anti-Asian violence, and we're going to be mailing it out to the Asian businesses in town, and that's posted on our website and on the Facebook page. So we've done a lot in our short time of being around. So we started, I guess, in January of 2020, and then the pandemic. So we would love to hear from more people. We're excited to work with you and to hear from you. So check out our Facebook page and the website.
Great. Thank you, Kathleen. So I'm going to go through and everyone can ask if you have a question. Elizabeth?
I don't have a question yet. I just want to say thank you. It's so good to know about you and what you're doing. And I do look forward to working more with you. I think that sounds amazing. I'm excited about what you're thinking about doing. And I'm especially impressed that you started doing this, basically right before the pandemic and were able to do so many things. So yes, we'll talk more, I think.
Mary Branley?
Ditto. Thank you very much. Thanks for the efforts.
Hillary?
Thank you for coming and talking. I've been watching your the recordings of your meetings, but it sounds like this one coming up, I'll have to try to make live. They're all remote, right?
Yes, we're gonna stay remote.
Okay. And then I was wondering if we had ideas. I wanted to talk to you about ideas. Would that be best to do from coming to your meetings, or with you directly, or like how do your meetings typically work?
So what has worked well, I'm coming to the meetings always, is always a fine thing to do. And there's, community concerns and, public comment. But also you can email me it's on the town website, the HRC general mailbox, and it goes directly to my email. I should know.
Hillary, are you talking about things for them to work on or things for us to work on with them?
Probably together, but
Okay.
I also had an idea I wanted to talk about. The idea of a town social worker. Like if we don't, since we're not doing the general social worker position with the ESSER funds right now. Seeing if I've had some conversations with the select board, but I think that I'd be interested in talking to some other people about some of that idea.
Okay, great.
Okay, Natasha?
I think that the mission of your committee is fantastic, and I appreciate the hard work that it takes to push the envelope in many ways where I think you're constantly being resisted. So thank you. My question would be, one, do you, do we see, and this might be more of a Lydia question, but just thinking out loud about how we can engage, there's any opportunities like for civic opportunities for students to partake, at the high school, as we're thinking about all of these pieces. I just wonder if that might be something that could potentially be explored in the future.
I can talk about that because I would love for students. I teach civics, high school civics elsewhere, but
awesome.
I run senior projects elsewhere. So I would love for student involvement in our committee. And we reached out at the end of the school year, and it was too late to get students involved through senior projects. But we would be totally open to having students work with us on initiatives and things like that. And so
I would really love to get a Maynard student who, it's giving back to your community. So just the idea that, maybe they need resources or guidance or whatever, just listening to the conversations that happen in our town. I think that's really, really, I don't know, maybe something to tap in on. So, and you're a civics teacher too. So bonus, on top of that. Thank you.
Awesome. And maybe at some point we discuss, Kathleen, maybe we could have a liaison if we get to a point where we're collaborating on a lot of things.
Originally there's a spot open for someone, an education person. So no one ever filled that seat. And so that seat is open. And also there's going to be some turnover at the end of this year. So
that be an appointed position?
No. Well, yeah, they're all appointed, right? Because
I don't know if a school committee person can be elected to a position and appointed on another committee. I'm not sure about that, but we could have a liaison from the school committee to your committee.
I see.
Yeah. But we can talk about that.
Sure.
Awesome. Thank you very much for coming and telling us about what you guys are up to. And I think that we will most likely definitely be in touch.
Yeah, I look forward to collaborating.
Yeah. Thank
you. Thank you, Kathleen.
Bye-bye.
Bye, Kath. All right, Jennifer Gaudet has her hand raised.
Thank you, Madam Chair. I just wanted to clarify one quick piece. Hillary and I totally appreciate the notion of the town social worker as a need to service the town, which you've talked about previously. As far as the district, it's not that we're not doing that this year. It's when we talked about it, we didn't know at what level that need was going to present. And so we're waiting to see what our guidance counselors are seeing in the fall. And if that is the need that we need support and connection to wraparound services, whether it's through a social worker or through additional seats in our family partnership with Assabet Valley, we will do that. So I just wanted to, that is still part of our plan moving forward. We just want to see where the need is first so we can allocate those resources accordingly.
I remember Jeff, you mentioned about checking data, like we were going to reasons for intervention. There was like some data collection that was talked about to understand, right?
Yeah,
What
so
you're
what we
seeing.
want to do is we want
Okay.
the guidance counselors to take a look at who is coming, where are they spending their time? Are they, what are the students presenting with? What are the challenges that they're seeing? What are the phone calls that they're having with parents? And so then once we see sort of where that is, it'll identify for us whether we need additional seats in this wraparound program that we're already involved with, or would it be better to have someone on site, type thing. So, but that is something that we still definitely have a plan for. Because we anticipate that the need is going to be there, even more so now than I think we did last spring.
Sorry, I was just trying to like be brief when I was saying it.
No worries. I just wanted to make sure folks knew.
Okay.
Okay. So thank you for that, Jen. All right. Next, two quick things. Master Implementation Committee, Mary Branley is the SC member of the Master Implementation Committee. And I believe at their last meeting, they said they were going to start looking at the school district's portion of the master plan. That is goal PFS 6. So if you guys could all familiarize yourself, I think there are about 7 steps or 7 support bullet points under PFS 6 that we are responsible for in supporting the implementation of the master plan. We are doing some of those things already, but they will come up in our discussion when we put together our goals this year. So
Can you repeat them again with those?
It's the master plan, Maynard master plan, and it's goal PFS 6. And there are 7 points of support underneath.
But you're echoing. Could you just say it one more time? It's something is echoing.
Yeah, something is echoing. I don't know if someone called in or.
So it's P is in Peter, F is in Frank, S is in Sam, 6. Is that right?
6. Yeah.
Okay, and then what was after that?
Well, you'll see underneath it, but there are 7 like bullet points of support of objectives that we are trying to. Yeah, I don't know what that is.
Mike, there's a Michael's iPhone that's not muted.
Okay. If you are not a part of this meeting, could you please mute yourself? Especially if.
Oh, sounds better.
Yeah,
Okay.
it's better.
Excellent. Thank you.
Actually, that Michael's iPhone doesn't have a volume tonight. I think, unfortunately, I think it's Mary. I'll give her the permission to unmute herself. So she can do that.
Mary. Jeez. You and your computers, man. All right. Last quick thing, and then we're moving on. Special town meeting this year. Special town meeting will be held on Saturday, October 16th instead of the 18th. It is going to be at noon at the Mill and Main parking lot. They've decided to hold it outdoors again. And I would ask that people familiarize yourselves with the warrant articles so that if there is anything that affects the school district, we can address that prior to the meeting. And if we need to weigh in or make a statement regarding any article, we have the opportunity to do so. So that is it for me. Our next business, AVLL softball. Jay Rashi was unable to be with us this evening, so we are moving right on to Aspen's this presentation from Adam Steiner, who has very graciously sat there in silence for 2 hours.
And Lydia, oh, sorry, point of order. Are we going to table that agenda item to the next meeting?
He's not sure when he's available.
Okay, so it's until. Okay,
yeah,
so
until further notice, it's tabled.
Okay.
Until for, yes, yeah.
Okay.
All right, Adam.
Thank you. I've built up a nice tolerance for long evening meetings, so this is 9 o'clock's no big deal.
Okay.
I thank you for the time to talk about Aspen. I think in normal circumstances, changing our SIS would be like the big challenge of the year or of the decade. So the fact that we're able to, we're on the right path with Aspen in the midst of everything else going on, I think is a real testament to Maynard schools and to our teachers in particular. So I'm going to share my screen. I wanted to take 3 minutes and talk about Aspen in general, and then give a short demonstration of what it looks like, and then I'm happy to take questions about it. And Brian may have shared some of this information with you previously, but I think it's worth reviewing.
Can I just interject, just so people aren't
Yes.
wondering while they're watching this? There will be a parent forum to provide more in-depth information for people once we're getting closer to the start of school, so that parents will know how to go in and interact with Aspen. This is just an overview for the school committee and the general, community interest.
Yes, absolutely. And there's been email information just today or yesterday. Parents have been able to log in, but there was additional information sent out with a family guide that's also linked in these slides that I can make available to all of you. So just to go back, more than a year ago, we formed a committee to decide whether we were going to stick with our old SIS, and if not, what we would choose. We spent months evaluating them, and there was a pretty strong consensus that Aspen was the right choice for us. And so starting in October, November, really up till now, we've had meetings every week, sometimes multiple times a week, to not only decide on policies, but also get Aspen set up the way we want it to work, and to make sure that stakeholders, which is runs the gamut, knows that Aspen's going to fit with what they're looking for. In July, we went live, so we were able to start using the actual Aspen site, and we still have our old SIS with a little overlap, but we really are good to go at this point. We've had ongoing training all summer. We're having additional training next week, and then when teachers arrive, we have Aspen trainers in each of our school buildings who are going to be leading trainings for our teachers. So why did we pick Aspen? One, it's very clear, it's consistent, unlike some other SIS options out there. It's all in one package. It isn't separate modules, so it's very clear. Easy for teachers, administrators, parents, the students themselves to access the information that they need. We can have assessment data coming from multiple locations and put it all in one place. And we can be absolutely 100% confident that all of the data that we should be reporting to DESE is being sent in a timely and accurate fashion. And none of this would have been possible without some really key people within the school system who have carried a lot of the weight. In particular, Trish Friedman, who is our data specialist for the district, has been the project manager for the transition to Aspen. And then the high school teacher, Rita Murphy, has really independently just taken on, because she just cares so much about this, the burden of being not only the teacher perspective, but also managing training and just doing a million things. And Rita is leading a group of 3 teachers who will be our Aspen trainers for the year. Lisa DeSalvatore at Green Meadow, Amanda Bailey at Fowler, and Rita. And they will have direct responsibility for sort of at the elbow support for teachers and also providing training as well. This is information that's gone out to parents, and this is what I'm going to show you in a minute, but there's an Aspen homepage that's got our Maynard in the web address there. And whether you're on your phone or your computer or an iPad, you just go into your browser and you go to that web address. They don't have a separate app, but if you open it on your phone, it adjusts itself so it fits nicely on your phone and it's readable there. Parents received an email with information about setting their username and password. And students and teachers are able to go to the Aspen homepage and use their Maynard Public Schools Google account to log into Aspen. So so teachers don't need a separate password to remember, or students as well, which makes it very easy.
Excuse me.
So right now I'm going to give a brief demonstration of what it looks like, just to give you a little flavor. I'll show you what it looks like to log into the. I'm going to use a training site because I don't want to show live data, but it looks the same, and show you the front page summary, show you how students and parents would look at their schedule and grades. And then there's also a link, as I mentioned, parents have received this link to an Aspen Family Portal Guide. It's still in draft form. We're making adjustments as we make some final decisions about things, but everything in there is accurate at the moment. So if it sounds right, Madam Chair, I'll go ahead and do my demonstration. All right. So, so this is the live site, just so, you know, if you haven't looked at it before, there's a area here. It says login using AASP. I'm working with Aspen to change that. That really should say something like login with Google, like a lot of websites have. And that's what teachers and students would normally use. Parents would fill in their login ID and their password, and they would log in there. The training site, this is the training site, which looks similar. It doesn't have that AASP button, but other than that, once we get into it, it looks just like the actual real Aspen site. So I have a sample parent one here, MTest. I'm going to log in as MTest and test mom here. And this front page, other than this warning that this is a training site, looks the same. So there's some basic information about accessing help. And then on the home page, which can be customized, there's a recent activity. So quick glance at assignments that have been graded, attendance issues that have come up, conduct issues. So parent gets really quick information to what they need there. If we have a report ready, like a report card, it would also show up on this home page. So it's like, let's give them the most key information right away. So that's the home page. So again, this is logged in as a parent. So if I click the family link at the top, I can see here's my child, test student, who's in grade 9. This family area is really information that you can look at and you can verify that it's accurate, see if anything needs to be adjusted. Anything that needs to be changed in this area, the parent would email the school or email help desk and we would adjust it. So one of the things we are working to make sure we're set with are contacts. So if a parent realizes, oh, my phone number is not right, or my email address, or I'm not getting messages for whatever reason, it's all right here and they can let us know and we can fix it. If they don't want to get emails, if they have multiple email addresses and this one should not be getting emails, they can let us know that as well. There's attendance information. This is all going to be blank, but there's, the health. This is really all the information that's out there. Transcript, they could look at historical, grading data going back if they want to look back at things. So that's all sort of profile information. The next tab is academics, and this is information on classes that the students are in their grades right now. So test student, I think I need to, all right, so test student is enrolled in all these classes. So the a parent could look at this and look who their teachers are. And then I think we have a couple grades in these just to give you a sample. So in geometry, parent can see, oh, okay, the student has a 92 average or rounded up to 93. And they can go to assignments, and we only have 2 quizzes here that we filled in, but they're doing really well. So they can, again, take a look at how they're doing in their classes. They can also check out their attendance data, make sure that it's accurate, and see how many absences they've had. Those are the main ones. I think that's enough to show you for now. I'll also show you what it looks like from the student perspective, which is very similar to that of the parent. So I'm going to log off as test mom and log in as test student, who's child of test mom here. So now that I'm logged in as a student, you can see and this would apply for Fowler and high school. Every student can log into Aspen, but there's less information provided at the elementary level. But a lot of this is the same. So the quick view of assignments and grades are there on the home page, as well as if there's a report card available. If the student goes to My Info, it has their information. They can also check it over. They can look at their transcript and like historical grades. They can look at their current schedule. So we have this filled in here. Right now, I know a parent has already asked me, okay, I want to print this, and which makes some sense. some students are going to want this in print. So in the next few days, we'll have a button set up here so that the parent will be able to print this in a nice, clean fashion so that it's can go right in the student's binder. But for now, students can look over their schedule. If they have questions, this course isn't right, they can contact the school to fix that. They also, again, under academics, can look at the classes they're in and their grades and what assignments are coming due. And so, and this is, you know, as teachers are grading work, it's available to the students right away. I feel like I talked a mile a minute, but that is, you know, very quick, high-level overview of what parents are seeing. Just looking at the, you know, the data coming in, I think hundreds of parents are logging in, they're trying it out. We're hearing from several about issues that we're fixing, you know, login didn't work or they're not getting the emails. And so it's, I think it's been a good sort of slow rollout so that we make sure we're 100% ready for the first day of school. And
Great.
Happy to take questions.
Thank you, Adam. I was on the committee that helped choose Aspen, and it was clear that everyone hated Tyler from all various backgrounds and uses of it. It was a disaster, and it was pretty much unanimous to switch to Aspen. I'm really excited about this because I think it's so much more user-friendly and more intuitive, and because I am horrible when it comes to, you know, I'm not even going to be using this, but if I were a parent of an MPS student, I would be really excited to have access to this. One thing, I think I remember under the family tab, you can have more than one student, right? So if you want to click between your son, daughter, whatever, you just go to the family tab and you can pick one. And so you don't have to keep navigating back and forth to try to look up each student. The other thing that we talked about was having add-on services, one of which was to connect IEPs and 504s to student records. Did we do that, or have we not done that yet?
We haven't done it yet. We 100% are in agreement that classroom teachers need to have access to IEPs. Jeff and I are working out how to make that happen in the best way possible, but that's sort of the given. They have to have that access. So how are we going to make it work? But
Excellent.
It will be there for day one.
All right, thank you. I'm going to go around now. Elizabeth?
I don't have any questions. I'm a teacher and I use Aspen already as a teacher. So I know how it works, but I guess just for the community, a couple of things that they might be curious about are, one, are the grades from past years going to be in Aspen if they haven't looked already? And then second, if they have any questions or they get locked out or they can't get in, they just email you, is that right?
Yeah, so in the first question, yes, all the historical data is in there, including past grades, and families can look at that now under the transcript. And then if any technical questions, like best way is to email help desk, because that puts the request right into our system and there's no chance that it's going to get lost in the mix. If they have a question about like the class the student is in or something more about school policy, then they can go ahead and contact the school office directly. But anything technical, help desk is the best option.
Okay, thank you.
Mary Branley, and she's muted.
No, I'm unmuted.
She
So
is
first of all, Adam is trying to help me, so I'm waiting for a gadget that's going to make this all go away. But thank you for your help. So my one, and I know Lydia and I had met with all the high school staff who really disliked the Tyler. So one of their main concerns or one of the main frustrations was the cumulative GPAs. Being on the scholarship committee, we were, trying to get the latest and greatest. And so this is it's gonna be all up to date and that no matter when we need it, correct? Perfect. All right.
Yes. I mean, the key thing is that, and one of the issues with Tyler was that it was so difficult to update anything that if we needed to change the way a class worked in terms of GPA, it was like, our data specialist would have to get in there. It was complicated. Sometimes Tyler would have to program things. With Aspen, our guidance counselors, if they see an issue, they can address it on their own, and they have the training to work on it themselves. Same thing with our building principals. one of the things that we've worked hard on is to really describe, who is responsible for which things, and making sure that our building administrators in particular have the training they need so that they can do the things that they're supposed to be doing easily and quickly.
Great, thank you.
Okay, Hillary.
I have a couple of questions. Can it do customizable reports? Like, can you ask it to query different things and get printouts?
Yes, absolutely. The other thing that we can do is for the next year, Aspen is still kind of backing us up. So if we decide we want a report that looks at, student achievement and some other factor in there, racial data, they'll produce reports for us and build them into the system to make it easy for us for the next year. So it's going to give us time to figure that out. And I should just give a shout out to Aspen. Like, I've been through a few different SIS transitions as a teacher and as a technology person, and they have by far been the most responsive and supportive. So it really made me feel good that we had the right, choice here. So.
How has the rollout been going, and how is it going for the teachers? Like, if this is brand new and they start, are they going to be comfortable with it right away? Is it like, do you have a training process that's going to get them on board so they're not, stuck on the first day of school trying to figure out what's going on?
Yeah, so I mean, there always is a challenge because teachers aren't, working over the summer. But what we've done is we've developed a train the trainer model. So we have our 3 training specialists. And some teachers have been getting into Aspen and looking around, but Brian has dedicated time, and the building principals have dedicated time on those first 2 teacher-only days to do Aspen training led by those teachers, which I think is the best thing. So we have Rita, we have Amanda, and we have Lisa, who know what it's like to be a teacher and have to take attendance. They know, what's required in terms of it being quick and easy and how to explain it in a way that will make sense. So I feel really good that they're going to get teachers prepared. The biggest things being attendance. I mean, that really has to happen on the morning of day 1. And then, starting with grading, grading assignments. And then as the year goes on, we'll tackle additional things that require training, like report cards we'll work on prior to the first report card issue. Toward the end of the year, we'll talk about placement and course recommendations. So it's really going to be an ongoing process throughout the year. But I think we've got some good, foundation blocks in place for the start of school.
Thank you.
Natasha.
Thank you very much. I'm really excited about this, and I will say that I was actually, Adam, just a kudos to you, the summer s'mores that you put out for technology. I just think that was really great. So thank you for kind of keeping all those technology conversations going and keeping families informed. And so I follow up on the IEP question. So I know other districts do. That was one of my really excitement about moving to Aspen, because they had this functionality where parents could access the IEP electronically. And so I would be a wee disappointed if we did not take advantage of that, because I understand not only for parent accessibility, because things have gotten lost in backpacks and mail, like just efficiency, but also I know internally it puts a lot of burden on our staff to resend things out, and sometimes parents just want an electronic version of their form. And so if there's an ability that I don't know what it takes or how much that would cost or whatever, but I expected that would be part of our eventually where we would get to alleviate some of the manual printing and stuff potentially that our staff does as well. That would be something I would really strongly advocate for as well. And then
I think he said that that's what they were going to do.
No, I think he said they were thinking about it, right? They weren't.
It's going to happen. They just haven't done it yet.
No, I should clarify. So
Yeah.
It's definitely not an absolute. It's something that eSped is our primary software for special education. It's really a trusted platform. We're in the process now of beginning to evaluate the potential that Aspen could do that, but we want the best system possible. And so, and you know, Jeff has really got experience with East Bed and with different systems, and he's reaching out to other special education directors. And so we're really going to dig into that the same way we dug into Aspen as our SIS. It's really a whole separate ballgame, and we're going to make sure we do our due diligence to decide whether that's the best thing for the school system.
All right,
Okay.
understood. Thank you.
Yeah, and well, then, so I will advocate that from the parent experience, the current process it doesn't meet, you know, all the needs. Maybe efficiency from the school, it really helps, but I know feedback from parents is IEP documentation, you know, it's just paper. We should be kind of thinking about how we are better navigating, even if the system that maybe we currently use cannot support it. I don't know, but I just want to advocate that we take advantage of this somehow. And I look forward to hearing more about when that conversation evolves. I'm sure it'll come up again. So questions I had were, would parents be able to register electronically instead of paper through Aspen, like at the beginning of the year?
Yes, so we didn't put that in place for this school year because we weren't live yet, but for next school year, yeah, there'll be online registration directly into Aspen. And that's going to save our secretaries in our schools a lot of time with data entry that they don't.
Very excited to hear that.
No.
Yes. And would we be able to post like athletic fees in Aspen and parents can pay electronically?
No, I mean, I don't even know if that's a module built in, you know, that is an option for Aspen. I would love for us, and we started to explore electronic payments. You know, I think we would like to move in that direction. It's just a matter of working with the town to make that happen. But I would definitely like to see us go in that direction. We're collecting expired Chromebook, you know, fees, and it's 1 million paper checks, and we have our optional Chromebook insurance program, and same deal, 1 million paper checks. I would love for that all to be electronic, but that's a separate challenge that, you know, the town really needs to buy into. So
I would like to hear more about what that exact challenge is at a future time with the hindrance, because I think we're probably leaving money on the table, possibly from uncollected fees. So I think, you know, thinking, you know, if it's a cost or whatever, or if it's just learning to do a different system. So that would be something I'd want to hear more about, if where the town would have a say in that versus us being more efficient in capturing revenue.
Natasha, that could be a subject for the 5-on-5.
Yep.
Too.
Yeah, but I don't know the what the hindrance would be. I guess what I would want to more understand if it's operational that I might not have that insight into. And then you said the historical information. Is there a way? Because I know with Tyler, you could change the calendar year, and I wasn't as obvious. I didn't know if is that something that was in that letter today. I don't know if that was highlighted, because I tried to look at my historical stuff and I couldn't find it, but
it may not have been highlighted well enough, which is a good point. So in any Aspen menu, there is a filter button, which kind of looks like a martini glass. And frequently by default, it only has the current year's information. Actually, when I was doing my demonstration, I was quickly fixing that to get all my classes up. But if you click the martini glass, you can select, all records, or I think you can filter by year.
I'll definitely look for a martini glass. And
I guess I should come with a
I like how that's hard to forget. So thank you.
It's all food to me. Hamburger menus and
the waffle. Yeah. I like how they do that with technology. Thank you very much.
You're welcome. And just a couple other comments, just things that you mentioned. So we are continuing with SMORE. So that's a technology we really adopted because of COVID. And so it's a newsletter platform that does automatic translation. We've got a lot of great feedback from families, administrators love it. And so that's something we're continuing with. And then the second thing I wanted to mention, just is to, make sure to give a shout out, to the town of Maynard and the selectmen for supporting the capital request that helped us to pay for year 1 of Aspen. If that hadn't happened, then we would have really been stuck in the mud at that point. So thank you.
Yes, thank you. And I do also want to say, I really, Trish has I already had an issue and she helped me. That the help desk, I just want to promote that, is really cool. If anyone has not used it, you get a ticket number. It's where you can track it. It's really easy, and I know it's super efficient for the large team of technology people we have. But I wanted to just make sure that folks really leverage that, because they're super responsive and do really great to follow up. So thank you very much.
Trish is fabulous and has been working nonstop on this. And I don't think she's on tonight, but she is really valued by all of us. And I know by the teachers as well, and staff. So
Absolutely. I inherited a great team in general. Jason, Dan, and Trish are terrific. I forced Trish to take a step away this week and catch her breath before, we really sprint to the start of school. So she earned that time off for sure.
Awesome. Thank you so much, Adam.
Thank you.
Appreciate your time.
Anytime. Talk to you soon.
Thank you.
Bye-bye.
All right. So now we are moving on to the EBCFA mask wearing policy. This policy is updated from last year's mask wearing protocol, and it was drafted and presented by the Massachusetts Association of School Committees. It's been vetted by legal. All we have to do is discuss it. If there's anything that we feel needs to be amended or added, we can do that at a later date. I think the important thing is, if we want to adopt this, we need to get it on the books today. So I will go around and find out if there are questions or points of discussion, and then we will get to the vote. So I'm going to start with you, Elizabeth.
I think I heard that Natasha had something she wanted to say before is that right? Or am I misremembering?
I was earlier. Yeah, I'm going to say something. Yes.
You
Okay.
can.
Oh, okay. You want me to go now?
Yeah, I'm giving you my spot. Go ahead.
Oh, okay. All right. Thank you for yielding the floor. So and it was actually a conversation that came up. Lydia, you mentioned it about the in students who need access. And I was looking, when I was looking at page, the top section where it talks about, let's see, access, medical, yeah. So the first page says, in addition, masks or face coverings will not be required for anyone who has a medical, behavioral, other challenge, making it unsafe to wear a face mask. A written note, and then it says parents may not excuse their child from. Oh, wait, no, that's not the section. There was one about, the exceptions under certain circumstances for children with medical, behavioral, other challenges who are unable to wear masks must be approved by the building principal in consultation with school nurse, and its face shields or physical barriers may be provided as an alternative in certain circumstances. And I didn't know.
That was my question.
Yeah, so that's what I wanted to get to a little bit more for our conversation. Is I think it's a very real issue that students who have disabilities that require, in order to access their education, be able to see the face of their peers, obviously their instructor, the educators. How can we frame this in a way that meets those needs? And I know they're not a lot, but it's critical that those, for social emotional reasons, that their peers, I don't know the right way to get to this, but that's where I thought might be the opportunity, that some emphasis there could be expanded on a little bit. And I don't know if that's something Mr. Ferranti would feel comfortable elaborating a little bit more on, but I think there needs to be some enhancement there. And I just, the template, this is just a template for math. They do say you can tweak it a little bit. So
right, and that's what I said, but I don't know that we want to tweak it and vote on it tonight. I think that we would vote on it, and then if we need to adjust it and tweak it, we can do that in a future meeting.
I have two questions. Lydia, first is for you. One is, if we vote on it, isn't this the thing we have to stick to?
This is the thing that we stick to, but it's on the books, and then we can, if we wanted to amend it, we can amend it. Like we could amend it next week. We could call a meeting and amend it next week.
Okay,
This
how about
isn't-
in November? Could be then, so it's
Yep.
like ongoing. Okay, that's
Yep.
good to know. And my other question for Natasha is, what about this, where are the holes, do you think, right now? Like what, because it seemed like reading it without, your background in CPAC and thinking about it as deeply as I'm sure you are, it looks clear to me so far that yes, if someone needs it because they have special needs that demand that they see people's faces, that there are options offered. So I'm curious about what you're seeing that I'm not seeing.
So I guess it's more about being a little bit more explicit in that last sentence, because just like we were talking about the homebound learning, people just need to tie that together. I think a little bit of it, something's not explicitly mentioned or referred to, it might not be understood as allowable or possible. And so I think that just in my thought would be that it could be that face shields or physical barriers may be provided as an alternative in some instances, such as students with, medical or whatever disabilities, or however we want to frame that language. And, I don't know the right approach to that, but I think that's where I would want to make sure that kids who are hard of hearing, who require to see, their teachers' lips or, in their, I don't want them to have to be pulled out. My point is that they should be included in the classroom. And my worry is that they would be, which I've heard happen, not necessarily Maynard, but some places, that because they might be pulled out because there's concerns that they're not wearing a mask or whatever. So I don't know the right approach there, but that would be my suggestion.
This is the thing you read. It's masks or face coverings will not be required for anyone who has a medical, behavioral, or other challenge making it unsafe to wear a face mask or face covering. A written note from a physician is required for requested exemption. Parents may not excuse their child from the face mask requirements by signing a waiver. So it sounds like it's covered. Like if you have a kid who's deaf, then there's a doctor's note and you have this exemption and you get something else. Yeah.
Are you talking about not necessarily the exemption for the child with the special needs, but the exemption for, say, the teacher? Like, Natasha, is your issue that it's not taking into account the other people?
I think it's both. Like, how do we ensure that a student's needs are met, that they're accessing their education with their teacher, right? Their educator, their interventionist, and their peers also. So, and just to be in an included environment. I don't know if it's plexiglass or whatever, however we're thinking about it in that way, but I just want to make sure that it's not, that part seems to be not as solid to me or captured.
And so Natasha, to piggyback on that and what I was thinking, and it goes back to what Olga Doktorov asked about the other night, like, because facial communication in high school and relating to teens and the importance for teachers to make the connections with their students, could they do just the plastic face shields? And I don't know the answer to that. I don't know if those are effective barriers or not. And Hillary,
they're like nearly useless.
Absolutely
the
not.
Plexiglass
No way.
and the face shields.
Yeah. But that's a choice. Like, that's the difference for me, is that would be a preference that someone would want to do. I'm talking about a student who needs to access their education.
Right, but what I'm saying is there something like that? Like, even if it's like I don't know, but something that would allow every member in a classroom. So say there's a kid who needs to read lips. Would every kid in that classroom be given a mask that the kid could see through? Like, would that entire class be given the equipment necessary to accommodate the child? That's where my concern is.
Well, I can tell you that there is precedent for, just an example, when a kid has a nut allergy, in the lower grades, they send a note home to all the parents, say, hey, no nuts and whatever for snacks. And the whole class, because that happens in the class and it's supportive of the child who has certain needs. So I think it is a one-on-one, you need to work it out with the director of student services. But I want to make sure that we are explicit that should be an accommodation in some way for, accessing the education and for peer engagement a little bit more explicitly, I think, than how it's just written right there.
I have a couple things to say. One is, I think Brian already showed us that, like, some of those masks that do exist. So there are things out there too. Maybe Jeff wants to jump in here, but 3, if we really want to think about this wording, I think Lydia's right. We should vote on this and then think more deeply about the wording so that we get it right.
So would it be that maybe we vote on it to reevaluate and?
No, we just vote on this, get it in, and then I think, like, I don't know, Lydia, it was my, my second meeting, but maybe you put on the agenda later, something, or we talk about it when we have our 5.
Well, what would probably,
meeting.
what we've done in the past when we've amended is the person makes the suggested amendment, and it either happens tonight in the meeting or it gets emailed to the policy subcommittee, and then the policy subcommittee looks into it, has Jeff review it, or Jen Gaudet, or whoever in the central office needs to review it, and if it's necessary, have legal vet it, and then bring it back to present and discuss and vote on.
Yeah, good. That sounds a lot better, because I wouldn't want to make a choice about the wording here tonight, because I think there are a lot of things that we're not thinking about or we can't think about at 9:42 p.m. And do well.
Yeah.
I think that it's important that we have a policy that allows all kids to access the curriculum. And I would support, the school paying for the masks with the clear space in front of them out for all the kids in the class. I'd support, paying for tables, or like finding a way for those classes to go outside far more often so the kids can be unmasked. And I support, face shields or plexiglass in really limited occasions, but the plexiglass and the face shields are basically useless. And I'm not comfortable with something that ends up with being no protection against droplets and aerosols all day long for a whole class. I think that parents really, the reason we had 100 people logged on earlier is parents want to know if we're going to require masks or not. Some parents want to know that specifically so they can decide whether or not they're going to pull their kids out to homeschool or try to enroll at TECA or something like that. So I think it's really important that we vote today on a policy. But I think that if we're going to tweak wording, today's probably not the best day or the best time of day. And we should be really careful about doing it. So I think it'd be good to have a commitment that we're gonna, even if it's like next week or the week after, to, really tweak the wording. Because I think we've all been focused on sort of bigger picture things and not necessarily wording of protocols.
So would it be, maybe Lydia, this could be, we would, approve and then also add it to the next agenda, just so we can commit to like a place where that's, we're going to circle back to it. I just know there's so many things going on, and I just hate for it to be kind of pushed back, because some of the things that I was also thinking is that, should we be reevaluating it at a certain, period of time, with certain frequency. Some school committees have done that.
I don't think we need to say like 2 weeks. I think some of the school committees, they're saying they're going to reevaluate every 2 weeks. It's a little excessive, but
I wouldn't say that, but I just think that something, and again, yet to be determined, but when we do revisit it,
The policy subcommittee has a meeting scheduled every 3 weeks, and we can do it every 3 weeks at those meetings, and any other policies that may come up. And if we need to do it more frequently or sooner than that, then we can always schedule, a meeting to discuss and decide. It's making amendments is not really that much of an issue. And as far as it getting lost in the shuffle, I don't see that as an issue, because we did so many policies last year and they didn't get lost in the shuffle, and we made amendments and we had them come back 4, 5, 6 different times after being reviewed and vetted and rewritten and amended. And we are doing far fewer policies this year. So, and this is an important one. So I don't worry about this falling off the radar at all. And yes, we can say that we will discuss it at our next school committee meeting. Hillary?
I think that normally, I think that the makeup of the people that are involved in this aren't people who are likely going to forget that making sure that, you know, kids with special needs can access the curriculum won't get forgotten. I know it's something that I'll think about every day. I won't forget about it. And so I think that normally I would be worried about that being pushed off, but I don't think with the particular people involved that we would do that. Oh, I forgot one more thing. Oh, I think that it could help for some people in the community to know that if numbers were to, you know, drop to like 100 cases a day and level out at that, like if our curve was to go down and level out, we would definitely revisit this. And that I assume we all would plan to revisit it when, you know, about 2 months after the vaccine's approved for kids. Like once all kids have the opportunity to become vaccinated, I would think we would definitely want to revisit it then.
Yeah, I would say it would have to be both those things, probably. You know, it would have to be that the numbers have dropped to very low numbers, and then the kids have had the time to get vaccinated, and then we probably should look at what percentage of our population of kids has gotten vaccinated. But yeah, I mean, I think it's pretty much a given we're going to have to look at this again at some point in the year, right?
We're going to have to look at all of it again.
Yeah, I don't think that there's.
We might even have to do it next week. I mean, the problem is it's a moving target right now, and very much like last year, things are going to shift and change, and sometimes it's going to happen overnight. Like something's going to come out of the blue, or the commissioner's going to decide to say something, you know, and.
So I don't even think we have to say it, because if we say it, it makes it feel unsettled. You know what I mean? Like we're not clear about what we want. We just vote on this, and then it's a given. We're going to have to look at it again, because just like this time, it wasn't a thing we thought we were going to have on our agenda, but then it just bubbles up, you know, in the society, and we have to address it, and that's how it is. Right. You know, if we started amending this, I mean, I might want to take out things like when we have physical distancing, the kids don't have to have their masks on, or I might want to take out things like that they can have face shields. You know, like if we really I don't know if we want to get into tweaking the wording tonight.
Right. Yeah. And there may be things that we haven't even thought of yet or haven't come up yet that we are going to want to include, or that is specific to Maynard that we may want to consider. So, yes, Natasha.
I just wanted to point out that the exception that clarification that Brian had in his exception to the math, that's not in this policy. So where if you're in a secluded or whatever, the way the policy is written right now is all in the school buildings. So I just want to make sure that's clear, that us approving it as it is does not allow for those exceptions that Brian has suggested in the protocols, unless I'm reading something wrong.
No, I don't think you're reading
anything. Face masks
wrong.
or face coverings will not be required when appropriate social distancing is enforced. So wouldn't that sort of apply to if you're alone in a room?
I don't know, because then it says they're required in all buildings, and I don't know what appropriate. So what is appropriate social distancing? Is that, is that in a segregated, is that the part where you need to clarify what that is?
I'm pretty sure that Brian can suspend that part of his thing, the alone or segregated, until we clarify the language in this policy. I'm pretty sure that that's not a bone of contention for him.
Okay.
I mean, Brian, I don't want to speak for you, but I assume that.
I just want to make sure we're consistent. If we're not going to be, if we're approving the policy tonight, we're approving it as is, and then so any other interpretation is not. It is what it is, and then we can tweak it at another time, at another meeting, for all aspects if needed.
So we're going to expect people to wear masks when they're alone in their room? I would say no, we're not. That doesn't seem reasonable.
I don't disagree with you. I also just want to make sure that exception is explicitly written in the policy, that what you're intending, because
if you're alone in a room, you're socially distanced.
But yeah, well, I mean, the whole line is additionally face masks or face coverings will not be required when appropriate social distancing is enforced in the following conditions: during mass breaks, while eating or drinking, during physical exercise, and while outside. That's
right. So those are those. That's what it's indicating. So it's not in.
How up? Okay.
So maybe we add a bullet there, it's.
When appropriate socially distancing is enforced in addition to
No, because that just means that's what I mean. If we start messing with the wording tonight, we're gonna
Right.
add some weird loopholes to this that you don't want to add, because if you put that in there, that means that if I'm 3 feet from you, I don't have to wear my mask. Because that is appropriate social distancing.
What about making it effective the day that people return to school, as opposed to making it effective next week? Because, I mean, I
No.
don't know, if, Brian's the only one there next week, or the people who are there next week. I don't know. Never mind.
I'm with Elizabeth. I think we just leave it alone, because I have a question about the next paragraph about the principals. It looks like our principals are going to have to be policemen, which I don't want to have happen either. There's a
I
lot
saw
of
that too,
subjectivity.
yeah.
So let's just vote on it tonight. And then we can tweak it, or we can send all of our comments to the policy committee for them to look at, and then we can come back to it.
So translating Mary, I think she said, because of technology, like, approve tonight, send comments to policy, and we'll review later. Okay. So same
Right.
thing, everybody. Okay.
Perfect. That's exactly right. Thank you.
Okay, so do I have a motion?
I'll make a motion that we accept the mask wearing protocol EBCFA as written.
Do I have a second?
Second.
Discussion.
Is this amended though? Is this, you accept the amended?
Yes, as written. This is the,
Okay.
yes, what
Okay.
we're presenting.
Okay.
Discussion. All right, Elizabeth Albota,
Yes.
Mary Branley,
Yes.
Hillary Griffiths,
Yes.
Natasha Rivera,
Yes.
Lydia Clancy, yes. Okay. Now that we have got that out of the way, we have one final item, and that is school committee members' reports. So I'm going to start with Elizabeth. And I was asked tonight if you have to speak, you do not have to speak. If you don't have anything to say during this period, do not feel pressure to. This is just an opportunity mostly to report on subcommittee stuff, but there hasn't been a lot of subcommittee activity, so do not feel as though you have to say anything.
I would like to go last.
Okay, Elizabeth's gonna go last. So we're gonna start with Mary Branley if her computer behaves.
I can speak for a minute before I get frozen. No, we're gonna, Brian, we're gonna have another meeting. One of the other representatives from the master plan, we're gonna see if we can sit down with you so that we can then present to the school committee in the next couple of weeks, like you're not busy enough. So that's
fine.
All right, thank you, Mary. Hillary.
I just wanted to say one thing with regards to the masks. I got a lot of comments from parents saying that they wanted to be the ones making the safety decisions for their kids. And I wanted to just comment that I understand that and I respect that. My rationale for supporting the mask mandate is that by making masks optional, we're not leaving the safety decisions up to each individual child's parents. We're in effect we would be leaving the safety decisions up to the parents of the children's classmates. And that's the part that I was not comfortable with. And then a sort of random comment is, I know when school starts and kids are told about activities that have fees and sports and stuff, can we try to make sure that they know that there's options for assistance and waivers and stuff for those? I know I've heard some kids, say that, they don't want to tell their parent that they want to do some activity because it costs a lot. And we might not be, telling kids that there's these fee waivers and stuff, or assistance for different programs, and they may never tell their parents, or their parents may never ask for help. And I just wanted to bring that up.
Okay. Thank you, Natasha.
So FinCom meeting next Monday. town budget subcommittee meeting next Tuesday. Next charter review committee is next Wednesday. And just a update on the charter review. It looks like we will be amending the charter to count when someone is appointed or recommending. I'll say, so the committee is recommending that when someone is appointed and there's an election, that the elected person take over immediately after, because that was some language that the charter was unclear of where the term starts. So that came up for discussion. The school department aspect came up for discussion, and as far as being responsible for, like, fiscally responsible for the building and your space, and I took the opportunity to remind that our school budget is intended for educational purposes, and that expenses related to fields and whatnot, all, that can't be the primary use of our budget, and yada yada yada. The town looks, DESI looks at how much you spend in the 4,000 codes and whatnot. So I just think it's an ongoing conversation, because that is just a constant misconception that just because we have jurisdiction over place, that we should be, paying for everything, and that, like, the field and whatnot, and that's not the intent of what a school department's budget should be doing. CPAC will be, they're looking to reconvene as a board. Lydia, you and Brian, about the 5 and 5, I don't know if that came up the select board, so I don't know if the 31st, it sounded like that was not yet confirmed, but waiting for Greg. I don't know if if David had been emailed, but he's the one who asked about it, so I don't know if it maybe be an opportunity to reach out to David.
Why wouldn't he email me? I don't understand why he wouldn't email me and ask me about it.
He mentioned it in the meeting. They were talking they were talking amongst themselves about their next meeting.
Got it.
And it kind of came up like, hey, well, we have our joint meeting. So some members assumed there was this joint meeting. And so I was there, and he said, is that right? And I said, I don't have information to confirm that, but I will pass along what, and Megan was there. Greg's on vacation, so she couldn't speak to that anyway. So I was suggesting that maybe, I don't know how, outreach to David, just to circle back, and whatever you all know, if in Greg's absence potentially, so that planning purposes can happen. Email communications. I just want to mention that I know the school department or the school committee had worked hard to get access or to get visibility into building level emails that were happening from the principals. I think that was with Tyler, but I think that maybe has fallen off. So I just don't know if that was part of the transition. I know we haven't seen communications that are going out at each building from the principals. So I just want to make sure that if that can get looked at, so that the school committee can still get those visibility into those parent communications that are going out from the principals and the vice principals. If that makes any sense. And then, and just highlight that the Board of Health, I know Hillary went back and listened to, that was a very interesting commentary that was going on with the Board of Health. And so there was some contention about a mask mandate for Maynard, and they did not feel that a mask mandate was important. The good thing that they did want to highlight, which I'll mention here, is that I guess the adults, the vaccination rate for adults is pretty significant. I think it's over 90%, and for over 12, kids 12 and over are over 80%. So those were good numbers, but they, some members of the Board of Health were citing some other things besides the CDC, and were questioning CDC, and I don't know, I was disappointed. But it was helpful that they actually did post on the website, which was good that they reaffirmed. That took a little bit of work, but they do reaffirm their recommendation to follow CDC guidance. And I think that's important, because that's what we're also looking at as well, and what the town is. So that's all I got. Thank you.
Thank you. All righty.
Wait, I get to say mine now, right?
Yeah, if you want.
Okay, okay, so I get to say that I do have a meeting. We have our first Communications and Strategic Subcommittee meeting next Friday. So there's that news. And this is a very tiny thing, maybe, but is there a way that on our agendas we can take the timeframes off? Because they're a lie. They're always a lie. We're
Well,
like,
but the thing is they're not supposed to be a lie, and
well, we could never have done what we did tonight during the superintendent's presentation in 15 minutes. That would have been insane. So that would actually have been bad for them. But maybe if we thought more about like how long it's actually going to take, and then maybe people could, you know, jump in and out as for the parts they want, and they don't have to stay the whole time for the parts they don't want. That might be nice for people. It's just a thing that I think when I look at the agenda every time.
That'd be awesome.
Thanks.
All right, is that it?
That's what I got.
Okay. All right. We have reached the conclusion of our meeting, I believe. So do I have
We have executive session? No?
No, we don't. I thought we did. Brian and I just threw it on there just in case we needed it. And then it turns out we didn't need it. So.
Oh,
And
darn.
it's not
I was
it's not on the posted agenda with the town either.
Oh,
It was
okay.
only, yeah, it's only on mine. And that was
Oh,
because
okay.
I thought, so no executive session. So thank you, Jeff, Jennifer, Colleen, Wayne. I don't imagine Wayne's still out there, but if he is, thank you to Charles. I don't know if he is. Thank you guys for hanging in there tonight.
Yeah,
I
you
swear
too.
we're gonna get it down to 2 hours one of these days. I promise.
You too.
Hey, Wayne. I had a lobster roll tonight for dinner. So anyway, I will accept a motion to adjourn.
I'll make a motion that we adjourn.
Do I have a second?
Second.
Okay, roll call. Elizabeth Albota,
Yep.
Mary Branley,
Yes.
Hillary Griffiths,
Yes.
Natasha Rivera,
Yes.
Lydia Clancy. Yes, thank you. And thank you, Karen Lindquist. I see you're still here. Thank you for hanging in there. And
Thank you,
Brian,
public.
thank you. Thank you, Brian.
Thank you, Brian, for all of your answers to our questions.